Hello, and welcome to Jason Cavness Experience. I'm your host, Jason Cavness. Yesterday is Rosa Crumpton. Rosa, thanks for being here today.
You.
So, Rosa, we're going to get into everything you do later on. You're doing a lot, but with everything you do, do you take time to have fun for yourself? Like, what do you do? What do you do for fun?
That's a great question. Right now, I'm a full-time grad student and working full-time, and so a mom and wife. So time is precious, but I do try to have some fun. Um, I like a lot of different things. One of the things I really like to do for my like me time is like read books. Um, and so I have, books on Kindle and stuff where I just try to fit in some of that time when it comes up. I like to travel, and I'm looking forward to traveling more once I graduate. Um, and just little things. I've been through a lot of things in life, and so I really try to enjoy each moment. So whether that's just appreciating when it's a sunny day and getting out there and going for a little walk, um, or just looking at things in a little bit different perspective. And so just really trying to seize whatever moment and just enjoy it to the fullest, whatever that means at that time. So a lot of times it's spending time with the family. Um, and one of the things I've really been trying to do, especially the last about year, is really making some of my healthy habits, like taking care of me, because I, as a nurse and a mom and all those things, it's I take care of lots of other people. So trying to figure out the things that I really enjoy. And one of the things I really value is health. And so I have been making time to work out, which I was not doing before. And that makes me feel better. And yeah, those are both the things. And one of the things I do really like to do is just kind of be creative and create things. And so I'm looking forward to graduating and getting back into like my sewing and kind of digital creative stuff, because that has had to take a back burner. But when I am creating, I really kind of get in the zone and I can like just go for hours. And so I'm an introvert. So I get recharged by just doing stuff by myself, and everybody else leave me alone. But um, other people, they don't think that's fun, but that's fun for me.
Same here. Well, cheers. Thanks for doing this with me.
Thank you. Thanks for having me.
So, when you read, are you reading for like professional development, try to be a better nurse, better person, or you actually read just for the maybe like the fantasy of it, or the
Both. Right now I read a lot for school, and I read for work as well. I try to do a balance, but I won't let you look at my Kindle because I have some trashy books on there. That's what I do for like fun. It's just like you know read the books that just kind of like I said take you to a fantasy world or whatever. Um, and yeah, when I have blocks of time, that's what I like to do. But I do have to do a lot of just professional development. I'm a really big proponent of like self development and things. So I read a lot of stuff about, bettering myself and investing and business things and just whatever is on my mind for that day.
so you talk about taking care of yourself, working out and stuff. Why is it so hard for people? It seems like I'm the same way. Like like you give, but you never like really take care of yourself. And what's the thing you can't take care of others unless your cup is full or something like that?
Yeah, yeah.
Why do you think so many people are like that? But is it because they think they're being selfish by taking care of themselves?
That's a great question. There's lots of kind of nuances to that. And for a lot of people, I think that I won't say just that are introverts, but a lot of people that are in helping professions, which you're like in HR, that's helping people too, right? Being in healthcare, we're kind of stretched when we're in our training and when we get out into the working world to do more, do more, do more. And especially since the pandemic, there's been more of a focus of trying to take care of yourself, but especially for women, we are kind of conditioned and socialized to take care of everybody else, and whatever's left, that's what we get and don't have a fit. And like you said, when your cup's half empty, it's really hard to give, and people will keep giving. And I see this a lot, especially with nurses, that they're great with patients. They give for their 8 hour shift, 10 hour, 12 hour, whatever shift there is. um and then there's not enough for themselves, and that manifests itself in how they interact with their peers. And so they might be the best nurse as far as like the patients are concerned, but if you talk to their coworkers, they're like, oh, that person is nasty, that person. And especially in nursing, there's a saying that the older nurses eat their young. And a lot of it is, I think, burnout and kind of moral fatigue and different things that nurses have been in the profession for a long time. They don't have any reserve. They don't have anything left to give. And, with the pandemic still being a thing, people are just really worn out, and especially healthcare providers that are doing different roles with less people. And, they may have already been doing it for years and years before. And so now they're to this point where they don't even know how to take care of themselves. They don't know necessarily what they like or don't like because they've just been full court press for so long.
So with the, eat your young thing, I might get blasted for this, but is that like a female thing? Because when I was in the military, just my experience, all the females like kind of senior ranking, they were like almost like treat the younger female officers and soldiers like crap, right?
Mm.
So is that a female thing you think, or
No, I
like
hear it a lot in nursing. I've
it
never
was
been.
definitely in the military?
I myself have not been in the military. I've been working with veterans, active duty, and family members for almost 20 years now. So it's a population I love to work with, and I'm working with currently. Um, but I don't know. I mean, there's a lot of socialization that goes with being a woman and growing up in America. And I know there's lots of theories about how women treat other women in a patriarchal society. So I'm sure that plays into it. I know specifically for nursing, you don't really hear it as much with like other disciplines, whether that's medical doctors or physical therapists or something like that, as far as I know. But with nurses, there is kind of a lack of mentorship, which in the military, I know you guys do have a lot of leadership skills and training. You guys are always going to like schools and stuff for that. Um, but if you look in the literature about kind of patriarchy, women are never in a patriarchal society, are always going to be, men here and women here. And so if you're following that school of thought, then the women are always going to try to vie for the top position. And so that also means keeping people down below you, right? Because that's how you assert
Yeah,
yourself, which is unfortunate because, honestly, we need everybody. We need to work together. It's tough, especially since the pandemic, people are like they're on edge. Like they don't have a reserve. They don't have um, that grace with them. Well, a lot of them have grace with themselves and want others to extend grace to themselves, but they don't have any reserve or willingness to have grace with other people. So it's really unfortunate. I don't know if it's just a female thing, but I do know nursing is, mostly women. And we definitely see it and hear it, and hopefully things will change
so
soon.
totally random question. Like
Yeah.
when the nurse gets off the shift, is there a place, a hospital, they can take a shower and clean up, or they have to go all home and like be nasty and dirty from all the sickness and disease all day long, and take care of it when they get home?
Usually at hospitals there are. Yeah, and it depends too on what discipline you're working, like especially the people that work like in the OR. A lot of times, you don't even wear your scrubs to work. You have to change into like the surgical ones once you get there. So those kind of people tend to shower before they leave. A lot of people are just like done and want to get the heck out of the building before they get asked to stay for overtime. So it kind of depends. But yeah, in hospitals, there's always facilities for that. And I know during the pandemic, a lot of people had their routines where they were showering, bagging up stuff, dropping it off, coming through the garage, and just really trying to keep all the hospital germs away from their
Yeah.
families.
So you've been a nurse for a little bit. Is it safe to presume that during the time as a nurse, you got more responsibility, but the pay really hasn't increased?
Well, nursing's my second career. So I started in research first. I got my first degree in genetics and cell biology and worked for a couple years. Pay was not great in the academic world. Went back to school, and while I was in school, I got my CNA. I worked at all levels of nursing. Then I got my LPN, worked as an LPN for quite a few years, then got my RN, and then my BSN, and now I'm currently working at my doctorate degree, which I'm graduating next month. So I'm really excited about that. Um, I will say, nurses make decent money. We make livable wages. They have come up some from the pandemic, but I think the thing that's especially for nurses and healthcare workers that are in like inpatient settings, um, the emotional toll, the physical toll, there's not really a dollar amount for that. And um, nurses at least here in Washington, we're paid fairly well, not in all states. But also the responsibility and what we call the acuity of patients, like how sick patients are, has increased dramatically in the last 10, 15, 20 years, where, if you've had any kind of surgical procedure or a family member, like they're trying to get you out and home within like 24 hours, right? Like if it's some kind of a planned surgery, they don't want to keep you for very long. And so now the people that are staying in the hospital tend to be really sick individuals with lots of what we call comorbidities or multiple different disease processes going on. Um, there are people that don't have a lot of resources, like they don't have a home to discharge. Maybe they have mental health issues on top of whatever, physical type of thing is going on. And so, uh, and sometimes they're just not pleasant people. So they burned all their bridges. They don't have anybody to call to say, hey, I'm getting out of the hospital. Can I stay with you for a couple of weeks while I, rehab? And so these people get stuck in the hospital and there's no place for them to go. And, if you're the nurse coming into work every day and you have to deal with somebody who is yelling and cussing at you every day, plus they're very sick, and they need care, they need their wounds, dressings changed or medication and all these other things, it is really challenging. And so it's hard to put a dollar amount on, you know, what does it take out of you to work with somebody, especially, we should get hazard pay, honestly, because, we're dealing with lots of diseases, germs, the risk of like needle stick injuries, um, then a lot of physical violence. There's a lot of physical violence against nurses and healthcare professionals. There's finally some legislation going on that's, actually charging that with a crime, but, within facilities, they have their own policies on what is reported and how it's reported and how things go. So a lot of stuff within that facility just never, you're discouraged sometimes from filing police reports for assault and different things. So it's hard to say that like the wages are proportional to all the stuff. And I think the public perception too, especially during the pandemic, I've been a nurse for, it'll be 19 years in May, a licensed nurse. And things have, a lot of things have changed. And one of the things with, I think the public, they don't realize the level nurses work at, whether it's a LPN, a licensed practical nurse, or a registered nurse. We're all licensed professionals. We've had to go through very rigorous schooling and then also take a national licensure board. And then we have to keep up with continuing education and things like that. But like I said, not a lot of people, they watch TV shows, like Grey's Anatomy, and they think that, the doctors are the ones that are taking patients around and walking them and feeding them because that's what's on TV, but that's not the case. If you're in the hospital, honestly, you're lucky if you see your physician or physician team 10 minutes a day while you're there. And nurses, we're taking care of patients 24/7. A lot of times, if when things are caught that, you could like go downhill, it's a nurse. And a lot of times it's actually a nursing assistant that's going to catch that because we're doing those hands-on care, noticing those subtle changes, and reporting them, assessing them, and that kind of thing. But when you watch on TV, it's always like the resident or the doctor is right there at the bedside, and they're like, "Oh my God, I know what this is," and that is, that is not what happens. So I think one of the things I try to do is, and nurses, again, back to that kind of like being a female profession and being socialized to not really brag about ourselves or talk about the stuff that we do, and also being overburdened with lots of things that you don't have time to like go toot your own horn or toot your profession's horn. You just got to get the job done, right? And so a lot of people don't realize. So it was very interesting in the beginning of the pandemic, 2020, we're healthcare heroes, right? And like that was the first time in my, pretty long nursing career that, I mean, we were getting pizza sent, we were getting food sent. Everybody loved nurses and healthcare people. And we were like, woo, 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 right? And I gained so much weight that year because there was always treats and food. And I was like, wow, oh my gosh, people see what we're doing and like that we're, risking ourselves coming to work. And then, then it's, there was lots of opportunities for travel nursing because of, there were nurses that were getting sick. There were nurses that were dying. There were nurses that were leaving healthcare because they're like, I have health issues, family members have health issues or whatever. So there's always been travel nurses, but there was a big boon of travel nurses that were getting paid extremely well. And, at first it was like, oh, they're helping out, which they definitely were, because they don't pay all this money for travel nurses if there's not a need, right? So there's a need for whatever reason. And then all of a sudden the narrative kind of changed to like, oh, these nurses are greedy. They just want so much. And when nurses were speaking out about, um, we're putting our lives at risk. We don't really know what COVID is or how to treat it. And, my nurse colleague just died, and we're not having proper PPE and masks and gowns and all that kind of stuff. And still the public perception, which is spearheaded by some different people have their own agendas. But it was so disheartening to see that all of a sudden now it's like, oh, nurses are greedy. Why do they want more money? These travel nurses shouldn't be getting paid that much. And it also caused a split too with when you have a staff nurse that's getting paid X amount of dollars, and then you have a traveling nurse. Now, mind you, they most likely do not have benefits or anything like that, which is your HR stuff,
So it's
right?
basically like a contractor, right?
They are a contractor. And so they're usually for a short term, a lot of nursing contractor, 13 weeks. And they're getting paid, but they're also leaving their family or, their house.
Going some random place never been before.
Right. And then back to kind of that nurses eat their young and stuff. So if you're a staff nurse and you're getting paid, we'll just say 50,000, and then this travel nurse is getting paid equivalent of 100,000, yeah, you're going to have some feelings. But instead of taking it out on this nurse that's actually here to help you, because otherwise you'd have 20 patients to yourself, and now you have 10 because there's 2 of you. Don't take it out on this nurse that's literally here to help you, and maybe they are getting paid.
Taking advantage of opportunity they're given.
Yep. I mean, you need to be talking to your facility. You need to be talking to your nursing leadership. And you also need to be starting to, look at legislative processes too, right? Because that's the only thing that's going to help change some of these things. But when you start taking things out on this nurse and giving them the worst assignment, treating them like crap, not giving them breaks and all these other things that we hear about, that makes them feel like, I never want to come back to this hospital. I don't care.
And they're going to tell all the travel nurse buddies, don't
Yep.
go to that place.
Yep.
And that diversion nurse is going to have 20, 25 patients to take care of.
And so it's this like weird vicious cycle.
Like, why do I have so many patients to take care of?
Yeah. Yeah. And so I one of the things is really challenging to me is like not seeing like civility between like personnel. And it boggles my mind. I can get along with just about anybody for 8, 10, 12 hours. I mean, they might work my nerves, but like I'm not going to really. And it's not that I don't like speak up or, I'm somebody that I try to give grace, and because I want to be given grace for things, because I'm not perfect and I make mistakes. But I also realize that a lot of times, especially in a hospital setting, I'm taking care of patients and their families in the worst time of their life. A lot of times, again, back to the people that are actually hospitalized, they're very sick people. They, may not have any place to go. They may have mental health issues on top of their medical issues. And so, extending grace, and I try to treat people the way that I want to be treated. And I also draw boundaries too. So like you can cuss. And like I said, I've worked with, a unique population for the last about 20 years. Veterans like to cuss and stuff. That doesn't bother me. But when you start cussing at me,
that's a big difference.
That's so I'm going to say, hey, you know what? I'm not going to cuss at you. I'm not going to yell at you. So please don't do that to me. I've had to say that to staff. I've had to say that to, patients a lot. And I draw those boundaries very, very quickly, and I stand to it too. So if you start yelling at me after I've given you this warning, and I'm say, hey, you know what? I'm going to come back because we're not going to do that, right? And some nurses don't feel empowered to do that because of how they're trained or their cultural different things, and that can cause a lot of resentments. And so then instead of them saying, hey, that's not cool to talk to me like that. Hey, don't say sexual things in front of me. Sometimes they let these things fester. And then it comes out when they start yelling at their coworker, or they yell at a different patient or even that patient. And they're just like, now all of a sudden it's like and this happens a lot to moms too, where they're like, okay, pick up this stuff. And nobody listens, nobody does it. And they keep reminding. And then finally mom's like, and everybody's like, why is mom tripping? Right. So same parallels. And so I think, in nursing and healthcare, we haven't really been empowered historically to like set boundaries. And so that can cause us conflict and resentments. And then people just blow up and everybody's like, oh my God, what's wrong? And it's like, well, they've been dealing with this for 2 weeks with the same person cussing at them and they didn't say anything and didn't say to that person, like, hey, I don't like the way you're talking to me. And, that does take a little bit of um, confidence, I guess,
Yeah.
and self-assurance. And if you're somebody that has never been taught or allowed to have that, that's kind of a scary thing. But then it turns into this big thing. And now all of a sudden you're the problem because you blew up on a patient or you yelled at a coworker or whatever. And so I see lots of those kind of incidents in my current role.
Yeah. So is there something that's shown like, X percentage of nurses, like get sick from the disease in the hospital and transfer to their kids or loved ones and stuff?
I'm not aware of any statistics. There's probably some around
Yeah.
like the pandemic and stuff. Um, just anecdotally,
Mhm.
I know in the last several years, it's like, one person gets COVID on the unit, then next thing that shift is like everybody's out, or scrambling and, or somebody at their house got it and that kind of stuff. But I'm sure there probably are some statistics, but I don't know.
Yeah, this like be higher, like, because y'all deal with all these sick people. Because you don't really hear like no nurses or healthcare professionals taking like, but you saw some of the flu, right?
Mhm.
I don't know. At least I don't see the numbers where they say Rosa got the flu from a patient and transferred to her kids, right? I don't see anything out there like that. I
And
mean,
it's
it
hard.
has to happen.
It does for sure, and it's hard to track because we weren't tracking a lot of stuff as closely as COVID. So, during flu and, in the fall and winter where people are in close quarters, and lots of germs like flu, RSV, now COVID, are all going around, people tend to get sick, and a lot of times, kids are bringing stuff home, and sometimes they're
I
getting,
mean, there's that too, right?
yeah,
Yeah.
parent sick, and then, but before the pandemic, I will tell you, it was very hard to get time off especially if you're working like inpatient, like sniffles or whatever. It's like, come on in.
Mhm.
And then with COVID, it was like, oh my God, you have any kind of symptom, like isolate, test.
I'm
Yeah.
sick.
Yeah. Yeah. So that's been like I said, I've seen a lot of changes in the time I've been in nursing. So before, yeah, I mean, healthcare staff would feel obligated to come to work even if they weren't feeling well. And they might wear a mask or, maybe they wouldn't see patients, but they're still around their coworkers or whatever, because, you know, in healthcare, it doesn't really stop. There's no, in the inpatient setting, it's 24/7. We're open. Even in the outpatient, for your primary care, specialty care, um, there's just not a lot of time to get behind, the way healthcare is dictated by insurance. For if you're an established patient going to see your primary care provider, a lot of times it's allotted 15 minutes for that visit. That's the total visit time from timer started as soon as you check in. So if you're 5 minutes late, now you got 10
Yeah.
minutes, right? And then that's also the time that the medical assistant or whoever is checking you in, doing your vital signs, asking you whatever questions. And then when the provider gets in there, maybe you're down to like 5 minutes and, you've got a list of things because, of course, it's hard to get time off of work and hard to get in to see the provider. And the provider's like, hey, we got 5 minutes, pick one, right?
Yeah.
And because they have other patients that are waiting and every minute that they're behind, um, it just gets added on. And so they're going to try to take care of what they can and tell you to come back for those other issues. And then they have to still chart on you, but their next patient's already ready. And so it's a ridiculous, pace. And so if you're out as a provider and let's say you had 18 patients scheduled for a day, which is pretty realistic for what primary care providers are seeing in their days. And I'm really sick and I can't come in. All those patients have to be rescheduled.
Yeah.
And you already know it's months,
Yeah. Especially I know with Madigan, it's like craziness.
yeah.
The one thing that gets me is like if you go like Madigan, like you go there and the nurse practitioner, whatever, asks you all these questions, right? Give them the answers. And then the doctor will come in and ask you the exact same thing. Like, are you freaking kidding me? Like she didn't like brief you or give you the notes right? Like, so next question. When the nurse on shift, are they like, is it like one doctor they're dealing with? They're dealing with multiple doctors.
Usually it's multiple, especially in an inpatient
And
setting.
the question is like, how do you as a nurse like manage these multiple doctors, right? I'm sure they have all different personalities, different needs, different
Cats
wants.
is the
Herding cat.
thing
Yeah,
to say.
how do you herd these cats?
Yeah. So almost always you're dealing with multiple providers. In a hospital setting, depending on what type of floor you're on. I currently work in a rehab inpatient unit. And so we have a little bit more stable staffing and we're in a training facility. So We work a lot with resident physicians. So yeah, there's always like multiple people usually you have to contact, and that's not even counting like specialty care because again, the people that are in the hospital tend to have lots of things going on. So they may have their main doctor for this floor, and then they have maybe a neurologist, a cardiologist, a podiatrist, maybe in rehab, physical therapy, occupational therapy, rehab psych, da da da. So you have to manage. So again, back to like the perception of what nurses do, there is this perception that nurses just follow doctor's orders, that the doctor is the boss, and they are the one ultimately responsible. But as nurses, we have our own nursing license that we have to maintain, and we have standards of care and scope of practice that we have to follow within. And a lot of it is independent critical thinking that we have to do. And so, yes, a big part of our job is managing all the cats because they're all going in different directions, and you have you're taking care of multiple patients who have multiple different providers. So there's a lot of high level thinking in nursing that you have to manage, not just the care of the individual. And that means like their meds, their treatments, wound care. A lot of time you're spending tracking down, um, imaging, getting orders for new medications because all of a sudden you have a headache and you don't have any pain meds. And now I have to call the provider and say, hey, so and so has, this headache, blah, blah, blah. So that's a whole job in itself.
So let's say a doctor like does something and it's like malpractice. They cause like a patient a lot of harm. If you as a nurse didn't try to stop and didn't say, hey, doctor, this isn't the right medicine, or like suppose the nurse doesn't do anything right, is the nurse responsible also is only on the doctor?
Nurses are getting sued a lot more for these kind of things. We see it a lot with like medications. There's been a couple big news stories in the last couple years about nurses giving wrong medications and things. Um, and so, especially with medications, as a nurse, you're administering the medication. And so, we have these rights of medication administration to make sure that it's the right patient, right time, that the med's not expired, so on and so forth. And when a med gets ordered, the provider orders it. They're doing their checks, making sure no, medication reactions based on the other medications, based on your condition, and allergies and all that kind of stuff. And they order it. Then pharmacy reviews it, and they're also checking for those same things. And then the nurse has to have a level of awareness of the medications that they are administering, and also thinking of those same kind of things. And then when they're actually administering the medication, making sure that it's the right medication that was ordered, the right patient, so on and so forth. Um, and so as the person administering, a lot of times you get put on lawsuits if it for malpractice, or medication error. Things like surgery and stuff, it's a little more challenging, but yeah, when somebody sues somebody, they can add whoever, and we are documenting, care of that person. So a lot of times the nurse's name is coming up a lot because we're, documenting frequently because we're at the bedside with the patient. Um, it's there's been a lot of there's like national patient safety goals um, that they create each year, and a lot of those some of those are like about surgery, making sure there's been certain checks and balances that have kind of been adopted for like surgical procedures, that you do a timeout. And so before you actually, like, everybody's in the OR or ready for the procedure, they say timeout, and they have a checklist and making sure that it's the right body part, and like everybody knows who this patient is, double, which seems silly, but because surgeries and different things have happened on the wrong limb, stuff has gotten, surgical instruments have gotten left in.
Yeah.
So yes, nurses can definitely be sued for that, but it's also this kind of hard thing because if you're a nurse and you're in the OR or whatever, and you say, "Hey, doc, that's not right," and they say, "Blah blah blah," I'm going to do it anyway. And there is this hierarchy in healthcare, um, that a lot of times nurses feel intimidated that they're going to get fired, and there's lots of different dynamics and different instances whether you work directly for that physician or not, or provider, that you may feel like you may not have a job if you speak up. Um, So yeah, it's a hard thing, but yeah, nurses are definitely getting named in lawsuits for sure.
So here's one for you. You might laugh at this, right? So as an Army, you always hear the stories about, veteran hospitals not providing good service, VAs being like kind of bad, overrun. I also say like, I don't understand like what's going on here. Like, how can I take care of this? Because in my mind, I thought veteran hospital only for military retirees. And I had no clues for every veteran in the United States, right? I for the longest time I thought just retired. Like, is there not many retirees? How do the veteran hospital having no trouble like taking care of retirees? No, Jason, for every veteran. Oh shit.
Yeah, it's a lot.
I had no clue. And I have a theory. I have no way to prove it, but like, I think there's kind of study done. Like in the military, there's good soldiers, bad soldiers. But there's a set of soldiers like always like problems with like chapter soldiers. They got after a year and a half. I just think in my mind these are the ones like complain all the time, right? Because they think we owe them something, right? Like there's a meme I saw like a month ago. It was like U.S. Army retiree, a picture of a guy looking like me, tattoos, long hair, smoking a joint, retired Army. You could never tell his Army. Next picture was some dude tapped out after 1 year in the Army. He had like the Army hat, the Army medals, like all this Army stuff, right? I just think like this one subset of people, like I don't say causing all problems because the veterans need deserve healthcare, but I just think they're like too many veterans are like, I deserve this, And like, what are you doing like to like make it better,
Yeah. Yeah. I mean, like I said, I worked with this population for quite some time. I'm not a service member myself or veteran. And yeah, I mean, the military service of veterans is a microcosm of the bigger US. And so you have people on all different kind of spectrums. You have people that are really great at everything, and you have people that are like problem children with everything they do. And most people are somewhere in the middle, right? It's kind of a bell curve. Um, but as you know, like 20% of the people can cause 80% of the problem, right?
Exactly.
And yeah, the VA services are pretty much available to almost every veteran,
Yeah, I had no
regardless of
clue. I thought
service.
it was like
Yeah.
retirees or
Retirees get TRICARE, which is a whole different
that's
ball game.
And was my experience, VA, at least American Lake's way better, right? Because TRICARE is like, for example, I went to Mexico in January and I cracked my ribs. Went to the emergency room like on a Monday, told me I have cracked ribs. They said call next day for an appointment, right? I would not get an appointment like another 65 days.
Oh, wow.
Yeah. So I just like fucking sucked it up, right? And like it was fine, right? It's
That's not what you could do for ribs anyway, besides
no,
pain management.
yeah, no, yeah.
And taking it easy.
And so when they were like giving me my medicine, they gave me some ibuprofen, some lidocaine. I was like, hey, I don't mean rude, but like I'm a lot of pain. Like I'm expecting some codeine, some cocaine, some heroin, like something, right?
No. Yeah, so they've really moved back from
The Oxycontin and stuff, yeah.
opiates.
Yeah, which they should, yeah.
There's a huge what do they call it now? Epidemic
Yeah.
with opiates, and we have lots of addiction problems, and we have lots of people making poor choices because they're trying to get their fix.
Yeah.
But yeah, with the veteran population too, it depends. I've taken care of veterans from as young as early 20s, and well, especially when I was working with active duty, 20s to 100, and everything in between. And I will say, depending on what conflict or what war you were in, your active duty service, there's lots of different personalities, and some of that is kind of generational. But I would say, in my experience, and this is kind of a generalization, but especially Vietnam veterans, they really came back and retreated very poorly.
They shit it on big time, yeah.
And they didn't get the care that they
didn't get what's the term they use now? They get the flowers. That's the term they use now. They didn't get their flowers and they came back.
That's a Gen Z thing. I'm older than that, but yeah, they did it. And I mean, and they didn't even get really like, dignity and respect of that. They were, most of them were drafted, right? Like most of them did not sign up, want to be in this war. They got sent out doing their civic duty or whatever, came back, had a lot of mental health issues that, went untreated. And then just the general public was treating them terribly because of decisions our government made. And so a lot of veterans that I've worked with in that population have been some of the most challenging, both health-wise, not really taking good care of themselves, having a lot of comorbidities. I see a lot of mental health issues, a lot of drug addiction, and that just kind of spirals where they're not really taking good care of themselves, and a lot of them don't have support systems either. And so just lots of challenges there. And yeah, it's interesting because again, like I said, I have not served, but I feel my service has been serving the veteran
Yeah.
population active duty for almost, 2 decades now. Um, but I've had, especially when I was working in a medical surgical unit at the VA, I had veterans that, had some interesting quirks or whatever. And they would say things like, sometimes they would try to check me, like, you need to do this or whatever. I'm like, I'm taking care of however, I'm going to get to you. I got to do all my assessments first. Cause when you first come on shift, you're checking to make sure all your patients, you get report from the nurse that's leaving. And then you want to go do your initial assessments and just check on and make sure your patients aren't dead. I mean, that's the bottom line. You want to make sure that they're breathing, they're in the room, you know where they're at. And then you're starting to check new orders, getting your meds ready to do your first rounds of meds and stuff. And so you're checking in on a patient, and he was kind of like, "Oh, I need my pain meds, blah, 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 blah." And it wasn't even time for his pain meds yet. And I said, "Oh, yeah, I heard that in report. I know that you're, in a lot of pain or whatever. You need to go get it. I'm a veteran, blah, blah, blah." I just started giving like, and I said,
You know
"Okay."
what? I hate when people do that. I'm a veteran. Like that's one of my pet peeves.
Like you
Like,
said, there's some good, there's some
we
bad.
know you're a veteran. Like
Right. Everybody here is.
obviously you're not be a veteran out here, right?
Right. I know. And so are the other 6 patients that I'm taking care of. So I try to, like I said, I try to extend grace. And I know that a lot of times when somebody's in the hospital, it's some of their probably worst days of their life. And I said, "Hey, I know I take care of all my veterans, right? You guys are all veterans, but right now I'm just doing my initial check in, make sure that there's nothing, critical. I need my pain meds, blah, blah, blah." Then he's like, he starts asking me, "Are you a veteran? Did you serve?" And I'm like, "No, sir, I didn't." I said, "But I think that my service is serving veterans here, and I'm going to take good care of you. Just give me a minute." And then he started trying to give me the riot act about, how he's paying my salary and this and that. And I'm just, I'm like,
Rosa, you're a better person than I am. 'Cause that motherfucker been put in the back of the line.
oh man,
He gonna he gonna like I would have like oh, yeah, yeah,
that's why I'm the nurse and
you're a
you're
better
not.
person than I am. Ain't no
But
ain't,
yeah, and so yeah, dealing with that kind of stuff. So again, back to like, our nurses paid enough? Like, if that's the stuff that you're dealing with every
yeah.
single day, no, it's not enough, right?
And then how do you keep from like I'm sure you keep from but how do most nurses keep from like taking that home, right? And
It's hard.
it has to be part of what's the word decompartmentalize?
Yeah. Yeah, we do a lot of compartmentalizing of trying to like, when you leave work, try not to bring it home. Because especially if your family, spouse, partner, whatever is not in the medical field, and you start telling them some of these stories, they freak out, right? And you're like, "Oh, that was nothing. Like, that was just one patient, 1 hour.
Yeah.
Like, I was at work for 12 hours," you know? And so it can be really hard. I think having nurse friends, whether they're like on your shift or other people that you can like share those stories with and kind of decompress. I think having those little self-care things that are helpful to you. Some of the things that we think are just so simple, and we know, especially as nurses or people in healthcare, like deep breathing or mindfulness or different things, they actually are proven to like
Mhm.
reduce stress
Okay.
levels, um, reset your hormones, all kinds of great things. But um, when you're in a high level, especially, it can be really hard when you're running, 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 and you're like in this high overdrive, especially since the pandemic. People have been working like here's 100%, and they've been at this level, and we're short staffed, and they stayed over and they did overtime, and they're like ramped up, right? And then how do you take that down? And even if you just try to compartmentalize and say that's at work, you can do that kind of mentally,
Yeah.
but then there's also kind of the physical part. And I see people get very, run down, very stressed out because they don't have a way to kind of let that energy out.
How do you deal with this? Suppose you have a patient, they're good, nothing's wrong with them. They keep on coming with stuff to stay in the hospital longer, right? You just say, Mr. Mrs., we appreciate you going through, but like the symptoms are not here. You gotta, I guess you just don't kick them out, I guess. You have to be a process, right?
There are processes. I work mostly federally, and so we have a bit different processes, and we don't, especially with the veteran population, we're not just kicking people out. Outside, it's a different story. I mean, especially when you have, insurance constraints, a lot of times insurance will only pay for a certain amount of time. And even if you don't feel ready, like you got to get on, right? They will discharge you wherever. Um, one of the benefits of working, federally has been that we're able to find more services and keep people a lot longer, which is both good and bad, depending on um, sometimes the attitude of the person you're caring for. But we're not just like kicking them out on the street. Um, but it can also be challenging. I know in the role that I'm in mid-level management that you see this, you have to try to kind of balance too, because sometimes one of the some of the most difficult personalities that are medically stable, but they don't literally have no place to go because they were unhoused previous to coming to the hospital. Now maybe they even have less function, so they can't necessarily discharge back to wherever they're living, on the streets or whatever. Maybe they need somebody to care for them, but they don't have any resources because even though like basically all veterans can get VA care, you're not necessarily getting a paycheck, whether it's retirement or disability or whatever. And then, as you know, there's like the different rating system and stuff like that. So if you are a veteran that's non-service connected and you don't have a income, where do you go? And maybe you burned all your bridges too. So like family doesn't want anything to do with you. So that can be some of the most challenging. And sometimes those are the most entitled people. And you're just kind of like, I see why nobody is here to
Yeah.
pick you up.
Yeah, I know. Yeah, I don't know. I know a lot of people complain about the VA and the service. I have friends like in the military. They complain about the local VA where they're at. But me, I have nothing but good things about to say about America. Like I've always been like, of course, I'm not always like super unicorn and rainbows happy and all,
Right.
but always been like these at a minimum. I've always been satisfied. Right?
That's awesome.
Yeah.
Yeah, I've heard the saying too as a VA employee that if you worked at a VA, you worked at a VA, that
Mhm.
every VA is
Yeah.
different. The veterans VA is actually the biggest healthcare organization
I
in the
mean, it's a
world.
lot
In
of
the world.
veterans. Yeah, it's a lot of veterans.
Yeah.
And is it veterans only? Or it's only it's not veteran spouses. It's
No,
only veterans,
no,
right?
no. Yeah. TRICARE veteran, spouses and stuff can be on
And
there.
so, what is a veteran? Is it like someone who like finished basic training, someone who did 2 years, or
I
do
don't
you
know
know
all
that?
the specifics. I don't
Okay.
deal with that, but in general, there's program. So um there are some specific criteria, which I don't know exactly, but I don't think it's just finishing basic. I think you had to have a certain amount of time,
Yeah.
but I know that there are certain programs that even, like, people that only maybe finish basic or something and you're, like, homeless, there's, like, programs to help, and sometimes there's limited care, for people that didn't meet the certain requirements, so maybe they can get emergency care. And I wanna, while I'm on this podcast, I always like to plug, like, if you are a veteran you served, please make sure that you enroll in your VA benefits. I know sometimes people are, like, disillusioned when they get out, and they're just like, "I don't want anything to do with the military." But those are your benefits, you earned them, and especially working on, like, the rehab side where, a lot of times we're seeing people that had a huge change in condition in a short period of time, whether that's they had a stroke, and these things aren't necessarily predictable, right? They've had a stroke, they've had an amputation, they've had some other like what we call acute, like sudden type of thing, a traumatic brain injury, because they fell off their motorcycle or they got in an accident. Like a lot of things are unpredictable, and the, uh, when we get contacted, because a lot of times with these kind of things, people go to their local hospital, not the VA or whatever. They go to their local hospital because they had stroke symptoms or whatever. And then the family is like, "Oh, they're a veteran. Let's get him to the VA." And then they call and they say, "Oh, we want this patient to come to the VA because they're a veteran." And then we start trying to look them up and it's like, "Oh, they never enrolled." So they're still eligible, but
Yeah.
now they're in the hospital sitting and we have to like start, and that's not even our,
Yeah.
that's VBA, not VHA. So they're starting that process. But while you're healthy and you're not thinking about it, please just enroll so that it's there, because you just never know when you need it. And there's some incredible programs and things that the VA is able to do because we are, government agency. And so, things like veterans that have had amputations, outside, it can be very hard for them to get approved for different kinds of both prosthetic like limbs, so like fake legs, fake arms, that kind of stuff. Um, and also like the actual like rehab training program to use those. And at the VA, like they can get multiple limbs because a lot of times we have veterans that are still very active or young or whatever. And so sometimes they need, you know, uh, lower leg prosthetic that is for hiking and camping, and they have ones that are like more rugged, and then they have ones that are for like sporting events and stuff. And so, from what I've been told, like outside, you might get one prosthetic limb, and that's like it for life. And at the VA, we have opportunities that they can get multiple and come for training and learn how to use them. And we have a lot of programs like can't remember the exact name, but um, like uh, veteran Olympic type competitions and things. And, there's lots of opportunities, within the healthcare system for veterans to be involved, to volunteer. Some of the best things that I've seen is when it's like veteran driven. There's like art contests and different things. And there's a lot of veterans that work at the VAs. And when they interact with veterans, even though they're not, like we have a housekeeper who is a veteran, he's always engaging with the veterans, and they love him and they connect with him. And so sometimes, like I said, sometimes it's like random people. I'll say, hey, like so and so, like something seems weird. I was in his room and he just seemed off, right? Because he talks to him every day. And it's like, I'm not gonna be like, you're not a healthcare person, which some people I've seen happen.
Yeah.
I'm gonna say, "Oh, let me go see what's going on," because I value every person in my team, because everybody, like I always say to my staff, like everybody's an adult, everybody's getting paid, like none of us are volunteers. And so like we need to treat each other like adults, and it doesn't matter what your title is. Everybody has their experience, whether that's life experience, military service, whatever. Everybody has valuable contributions, and we got to work together. So, but I literally, like the housekeeper has said on different, like something doesn't seem right, or this person's getting riled up. Maybe
Mhm.
you need to go. And it's like, okay, let me go check that. So that's the thing that I really try to be really big about is like building teamwork, because you can't do it alone.
No,
And
no.
it doesn't work when only a couple people are working really hard and other people are being lazy. Um,
Is there anything the VA cannot do? Like suppose someone came in there and like, oh man, this guy has stage 4 cancer, or this guy needs a heart transplant or brain surgery. Anything like too advanced that you have to like send somewhere else?
you know what? We have a lot of really specialty services. We have a lot of programs. There's certain diseases and conditions that the VA treats best because we've studied it, researched it, and sometimes isn't things happen in higher proportion in the veteran population, like MS and ALS. There are certain surgeries and stuff that we don't necessarily have that particular specialist on staff or whatever. So, like here in this area with Puget Sound VA. Um, a lot of folks would either go to like University of Washington or Swedish, um, Harborview, that kind of thing. So yeah, we do send. Sometimes we have a veteran and something happens, or it's something planned or whatever, and they'll go to the best in the VA's and that kind of where they're already inpatient. The VA is going to pay for it, and then they'll come back, um, or sometimes they'll discharge from there. But a lot of times they'll come back.
So you getting your PhD, correct?
I'm getting my DNP, Doctorate of
DNP.
Nursing Practice.
So why that instead of just becoming a doctor?
That's a great question. I've never wanted to be a doctor, honestly. And like I said, nursing is my second career. I started in research and I wanted to do cancer research. I lost my uncle from cancer when I was 5, and I was like, I want to find the cure for cancer. And that was really my driving force through undergrad and early on in my career. And I worked at University of Washington for a few years, even though I'm a cougar at heart. um, and like I said, it pays very low, especially being in academia. And the thing that I didn't really realize being a student, and I'm first generation college student in my family, was I didn't realize that the kind of research academia world that everything is grant driven. And so grants are here today and gone tomorrow. And so it is very cutthroat. It's very like you have to publish the first, you have to publish a lot, and then you have to beg, borrow, and I guess not really steal, but to try to get grants renewed. So I ended up being, I was in a small lab. I was doing a lot of work there for several years. And then it was like when the dot-com bubble burst. And so a lot of grant funding just dried up. And so I got laid off because I was the newest person. And I was already thinking about, hey, I think I want to work with people more, which I questioned that decision a lot, especially being an introvert. But I ended up going back to school and getting my LPN. And that opened up a lot of doors, especially with having the research background. But yeah, I never, I honestly wasn't even seeing myself at being a nurse practitioner. Um, my husband actually has always encouraged me since uh, for a long time that I should go on and continue with my education, which I have quite a few degrees, and I just love learning. I love being a student. But the thing that sets nursing apart from medical school or the medical school of thought is that nursing tends to be a very holistic, and we look at the whole person. We don't just look at the disease process and try to fix that disease process. We say, oh, you have high blood pressure. What's contributing to that? What are you eating? What are your stress levels? What are these other things that we can help modify? What else is going on in your life? Or you're in the hospital and you're getting ready to discharge. It's like, okay, it's not just a date that we're gonna say, okay, see you later, but also like, do you have the supports that you need? Oh, you're a single father with 3 kids, like who's gonna come help you? And so nursing just always kind of is very person centered and family centered. And so I really appreciate that about the nursing field. And when I decided to go back to school and get my nurse practitioner, I'm in a family nurse practitioner program. Um, I was like, I want to be able to take care of kids and adults. I Part of the reason that I went back to school was to honor our son Trey, and so I was like, I wanted to be able to take care of kids, even though I've been working with adults for a long time. And I really like working with kids too. But like I said, I partial to the veteran population. But yeah, it wasn't even really a thought, and it's interesting because people a lot of times will say like, "Oh, you're a nurse." Well, that just means you're not good enough to be a doctor. And a lot of people don't desire like people see again, part of the patriarchy. We see, physicians at the as the top and that everybody wants to get there when I don't know if people ask like physical therapists that also most of them are getting doctorate degrees now, occupational therapists, oh, why didn't you want to just be a doctor? And maybe it's because it's just more common vernacular. But I'm proud to be a nurse and I'm proud of the care that I have with my patients. And I really like, the program that I'm in and the way that we've been learning. And I love working with physicians too. Um,
So why Pacific Lutheran University? Because my daughter graduates from there, and it's not the cheapest school around, right?
oh God,
Was
no,
that because it's like closest to your house or the best program or
they are very they're pretty good with their rankings. They have a really strong nursing program. It was a variety of things. When I did decide that I was going to go for my doctorate of nursing practice as a family nurse practitioner, I looked up at UW and because I was playing around with maybe doing just pediatric and was thinking, oh, maybe I'll work like in the NICU or whatever. But actually, UW doesn't have the NICU program or neonatal nurse practitioner program. Um, but one of the deciding factors was with UW, I would have to retake statistics. And I was like,
you're like F that?
exactly. And then POU said, nope. And POU is closer to my house and stuff like
Yeah,
that. But
that's an easy decision.
I was like, I just stopped pursuing. I had been getting
It's like
information.
this extra student loan money I got to take out. It's worth it.
Yeah. They were like, it has to be within 5 years. And I think at that time it was 7 years. And I was like, I'm absolutely not taking
No,
statistics over
I
again.
would never take it over
Yeah.
again.
Yeah.
No,
So that narrowed the field. I'm really happy with PLU's program. It's
they have a
small
really good
classes.
reputation,
They
especially for
do.
science.
Yeah, they do. And the classes are small. We get a lot of interaction with our professors, and we have a diverse uh, teaching staff of nurse practitioners, MDs, um, PhD nurses, and all that kind of stuff.
Now, of course, it's not exactly the best neighborhood, though, right?
No,
I mean, it's like,
it's the hood. But
yeah,
I'm a Tacoma girl, born and
yeah.
raised, so it's
So
kind
you
of
see,
like,
good, yeah,
yeah, I always watch my back, but it's
yeah. So you graduated from Washington State with a degree in, I think, genetics and cell biology, correct?
yes.
What age were you, or how young were you when you like, I want to do science or STEM?
Oh, I was young. Like, my uncle passed away when I was 5, and I was just like, "I wanna cure cancer," and that was really a big driving force for me, and, there's quite a few, folks in our family that have had cancer, and yeah, I've always been that kinda kid that was like, "Well, how does it work? Why does it work?" I was very interested in computers at a young age and just technology, and so I'm actually kinda unique within, like, my peer group of nurses that I loved I love computers, I love technology, I love trying out new things, like, I'm working on a WordPress uh, website right now, and I learned about that like years ago, and then kind of went to other website platforms, and then I'm back to WordPress, which is lots of flexibility, but also lots of learning too. So yeah, I STEM has always just kind of been a part of me, and my parents were very encouraging to, you know, when I'd ask those questions of why or how, and let's look it up, and yeah, I just always like science.
So I'm not expecting you to know this answer, but there's a stat out there somewhere that says like 80% of young female elementary school like want to do STEM right. By the time we get to 10th, 11th grade, that's down like 10, 50%. Why do you think it's such a like a this such a bad decrease? The societal pressures, the pediatric, what do you want to call it, or like this, or is it because science is hard?
It's a combination. Science is hard. You know, actually, up until this program, this DNP program, my bachelor's in genetics and cell biology was the hardest thing, and I have a master's as well. And the MBA was much easier than that BS in genetics and cell biology. I mean, I had tears, blood, sweat, all that. Um, I took my oldest bonus daughter years ago because I was really trying to encourage her for, STEM and just college and all the things that are available. She was probably about 11, 12. And we went to this conference. I don't know if it was here in Seattle, called She's Geeky. And it was all about like STEM for girls. And they had, it was in the Google building and some other like computer science that's has a big headquarters. And it was interesting because there was a number of women that were in STEM that were from India. And they were saying that in India, that there's not this divide, that there's just as many like women engineers and computer science and all that kind of stuff as men. It's pretty 50-50. Where here in the US, we see in STEM, especially like computer science and stuff, because a lot of the companies and sponsors and speakers were kind of in computer and tech side of things. Um, you see a very high predominance of males. And so that was a really interesting thought of like, what are they doing differently? There is I don't know exact statistics, but there are quite a few studies that have showed that, you know, um, those girls that in their young, elementary age that were really excited and were getting called on, they start getting picked on, especially as they start getting to middle school and high school, and then they step away, gradually kind of step away from those things. Um, and so we have to do better. And, some of that is parents, some of that is, school systems, and some of that is, you know, training our kids in a different way too.
Yeah. So we're gonna change this up a little bit. Do you still do your sewing blog?
I, I think it's probably still up there, but no, I haven't made anything really in,
No.
in quite some time.
Have you? So you're not active on that anymore? So what was it?
Mm-mm.
You just like wrote this blog about you was like you were sewing and stuff?
I mean, I will post it on like my personal
Mhm.
like Facebook, but I think I might still have like a blogger blog that I probably could
And
access, but I
what
haven't
kind of
put
stuff do
anything.
you sew? Just like
When I have time, I really like to do kids' clothes. I like to do embroidery, machine embroidery. Um, I like to sew clothes for myself. So I'm looking forward to getting back into that. I still spend a lot of time on other people's sewing blogs and like Facebook groups and stuff. I just love the creative process. I love, um, and I think too we can think about these differently, especially when we think about our generations before us, like our moms, grandmas, great grandmas, and stuff. They had set like there is like a STEM component to planning out a quilt, to creating blocks that are going to fit together and having that precision, especially if they're hand stitching all this stuff, to know how much materials. And we don't I don't think highlight a lot of things that are quote unquote women's work um in these other dimensions. But you have to have a level of like spatial
yeah.
awareness and things to plan things out. And there's color theory, and there's all different kinds of patterns. And you know, I'm not a quilter. I've made a couple quilts, but you had to be very precise, especially for things to line up because it's very apparent compared to like clothing. Clothing you can be more messy. Um, and with quilts, the points they should match, the corners. And if you have squares, if they're off, you can, it doesn't take a trained professional to say, oh, that's kind of crooked, right? Like anybody can see that. So, I think looking at quilting and saying, wow, these are some STEM skills too, can really help.
And was this like a stress reliever for you?
I like growing up, we were poor. And so we're always making gifts for each other. We had kind of a big family. I grew up one of four girls. I'm the oldest. And so we were always making gifts for each other. And I got into sewing. I had done like little hand sewing and stuff, but I actually got into sewing. It's kind of funny. My junior prom, I decided I was going to make my own dress. And I told my mom, and when you're like 15, 16, you could do anything. And like nobody, your parents especially can't tell you, right? Nothing. So I was like, I'm gonna make my prom dress. And my mom was like, what? I was like, yeah, I don't really like the styles that are out there, da da da. And she was like, okay. So she like pulled out my grandma's sewing machine that she had inherited, and it was like this old Singer. I'm like, okay. I got these books from the library and about how to like do fitting, because sewing is one skill, but being able to fit it, especially to a curvy body, is a totally different skill set. It's not just sewing. You have to know where to take things in, how to adjust things, especially like when you're doing the best is to do the adjustments on the pattern before you actually cut out your fabric. But yeah, I got these books and I was just like, I'm making this dress, and I picked one of the hardest fabrics to sew. I'll have to send you the picture. I picked this purple satin because purple is my favorite color, and satin is not a beginner friendly fabric because it's so smooth, it shifts and stuff. But yeah, I sewed my prom dress. Um, and looking back, I'm like, what in the world made me think that I could do that at that like lack of skill level? But I did. I made it. And the funny thing is that the sewing machine gave up the ghost right as I was like trying to finish it. And I'm like finishing it right before my prom date's supposed to pick me up. And they had to I tried to duct tape the hem because the machine was like not working, and I didn't have time to like hand stitch it or whatever. So then when we went to my date's house, his mom helped me put in some like temporary like tacking stitches for the hem. But yeah, looking back, I'm like now where I'm like, but somebody was like, I want you to sew me a satin, formal dress. I'd be like, what the hell? And I've taken classes at fashion design school, and I'm like an intermediate advanced sewer. Like I have those skills. I didn't have those skills there. And I'm like, God, I was so fearless. Like kind of what you're saying. Like I was so fearless. And then life beats you down, and you start doubting yourself for a lot of us. But yeah, that really got me into sewing. And then after that, I was kind of like, oh, that old machine, that was a problem. So I bought like this newer, I don't know if it was a Singer, like from Walmart or whatever, like $150 or whatever. I used my little McDonald job money to buy it. And I was like, oh, this is going to be so much better. It wasn't. It was like sewing crooked, and it was giving me the blues. And I ended up getting that machine repaired. And that machine's the old machines that are like all metal construction, they're like a dream. It hadn't been used for
Oh,
however many years. And then I put it through its paces sewing this formal, prom dress in satin. But yeah, that's what got me into sewing. And then I kind of didn't do it for for several years, and I graduated, went to Wazoo, and then I started getting back into it. And I was like, I ended up buying a very nice FOF machine, which like German construction. I paid a pretty penny for it, and I still use that machine. So it's over 20 years old. It's still a great machine. Um, and then as when after I got married and got my bonus kids, I liked sewing for them and stuff. So I started doing a lot of kid stuff.
nice. So a while ago, you did a Medium article on um, am I ready to ask for promotion? You remember the article you did? Can
Oh, that was a while ago. Sure.
you
Yeah.
talk about that?
Gosh, I don't remember exactly what I wrote, but it was about negotiating.
Yeah.
Yeah. So one of the things, my dad passed away when I was 17. It was my senior year of high school. Um, and one of the things that he gave me a lot of life lessons that I use to this day. And, I wish I could talk more things through with him, but I am able to hear his voice, in my head, not in like a crazy way, but just like, okay, this is what my dad would tell me. And so, he would negotiate like everything. And this man was just somebody that was like lucky. And he would win. He would call up when they do those like radio station contests, and he would win most of the time. So I remember one time we got this like I don't know, lifetime, it was like a year's supply or something of like Shasta soda. And our family, we ate really healthy growing up. Um, and so like we didn't like we really didn't have soda in the house. So then it was like, oh, mom can't say anything because we have like cases of soda. So that was kind of funny. But my dad, like, he taught me how to negotiate. And so um, I've negotiated every car I've bought. I've negotiated my jobs, including federal ones, which people don't think you can do, and you can. Um, and so I don't remember exactly what I said in that article because I think it's been a few years, but some general principles that I try to help coach people with. Um, if you are, especially, now with the pandemic, a lot of times people are working short staffed and you're probably doing the job of one or more other people besides yourself. Start keeping track of those things. Keep a little, Word document or spreadsheet, Google Doc or something. Throughout the year, you can start today and just start, you can think back of like, what have I done in the last year or last 6 months or whatever time period. Um, that's not just my normal job responsibilities, but the things that I've really stepped up, whether it's being on a committee, whether it's, volunteering for overtime, changing your shift, being a team leader, going to charge nurse training, whatever that is like extra. Start keeping a log, and it's great when you can put little dates in there, but it doesn't have to be exact. Um, if you've gotten further education, especially related to your specialty, add that on. Make yourself like a little brag list. Back to like nurses don't really like to hype themselves up, and even with their promotions, a lot of times nurses don't necessarily do that self eval. They'll just let their boss write it or just whatever you did put last year, whatever. But this is your time to kind of bring those things forward. Um, and, most things are negotiable. When if you're already in a job and depending on where you work, there may be some constraints, but it doesn't hurt to ask. And when you ask and you're somebody that's a value add because and maybe you're not even doing things extra. Maybe you're just showing up to work every day and your coworkers are not. I have 100% attendance. I have 80% attendance, whatever. Um, I've only had one call out in the last 6 months. Um, Focus on those things. Those are your negotiating points. And then, learn about your system and see what is the things that you can ask for. Sometimes you can ask, for more pay. Maybe you can ask for more vacation time. Maybe you want a promotion, like as far as the role. Maybe you want to be the actual charge nurse or whatever. Um, but yeah, you start with having the things that you're doing, and it's not just doing the bare minimum. Um, that's not going to get you a raise or promotion.
So this is like a generalization, but if it seems like men tend to oversell themselves and females undersell, right? For example, this is like a extreme example. Like, a guy works for a company for 6 months. Hey, boss, I've been working time every day for 6 months. I deserve a raise. He might get it. A female might have like closed a $10 million deal, increased something by 37%. Go ask for a raise. I'm just doing my job.
Yep.
Like, how do you convince like females like be more like, I won't say aggressive, like more aggressive, like, asking for stuff?
Yeah, it is a very there's lots of data that shows that that's part of the reason of the wage gap, not all the reason. Um, and it's hard to go against socialization because women are socialized to make everybody happy, everybody around them, and be, pleasant and not necessarily speak up for themselves. And it tends to make a lot of women like conflict in a way, conflict avoidant when it's not even conflict, right? You're just saying, hey, I'm doing these things. And the boss may be happy to they're not going to give it to you if you don't ask, right? Because they're worrying about whatever they're worrying about, not bringing COVID home to their kids. And, they're trying to get a promotion, right? But if you ask and you say, hey, this is things I've been doing, this is the value that I add. And it doesn't have to be confrontation where you're like, I'm going to quit, hopefully you're negotiating when you're not in that space, right? And you're saying, hey, I went to charge nurse training this year. I'm the charge Monday through Friday, blah, blah, blah. I have only, I haven't called out or, whatever your pluses are. Um, I got nominated for the Daisy Award by a patient, yada, yada, yada. What are those, you know, I would really like, and you have to be specific too, like say, I would really like a raise, or I would really like to be the permanent charge nurse. I would really like, um, and have a conversation. Don't think of it, you don't even have to use that term negotiation. Just think of it as conversation And at the end of the day, hopefully you're going to get some of what you want. And, think about some alternatives, because maybe they don't have money in the budget to give you a raise, but maybe you could get, more PTO or time off, or maybe there's a training that you want to go to. And that's like a win-win for both your employer and for you. If you go to training and then you come back and you share that information, right?
Yeah, I know like every female I kind of mentor, I always tell them, I don't care if you're happy with what you get, ask for something else.
It is.
Like suppose you want 100,000, they give you 150, ask for more vacation days. Like get get them in the mindset you're gonna ask for more, right?
So I'm in a program with other nurses that we're getting ready to graduate with a nurse practitioner. And I keep like, you could ask any one of them, because I'm like, oh no, ask for something else. And they're like nervous. And it was interesting. We had a class where we were talking about HR and stuff. And I was the only one who said that they had negotiated. And this out of like about 16, 17 people, um, classmates. And I was the only one who said that they had ever negotiated on
Yeah.
a job.
Like I don't know any job where like suppose they offer you 100,000, you say no, 110. Oh no, we send a job offer.
No, they won't.
Yeah,
I mean, they want you.
and if they did, you don't want to work for the company either,
Exactly,
right?
exactly. Yeah, no, it's, women aren't really taught that. I don't know. It is a bizarre thing. Like I said, I learned it from my dad, and, it has served me very well. And I try to share that information, and the more you practice, the less scary it's gonna be, right? The
Yeah,
first time it's gonna feel like, "Oh god, I can't ask that." And I remember even my very first job when I was working at UW, which is a government job, there's not necessarily the same flexibility as when you work for a private
yeah,
entity, right? But and I've been very fortunate too to have some great mentors along the way that have shared information. And I always try to share information. I don't try to gatekeep
yeah.
anything. But one of the PhD scientists I worked with that came to our lab for a while, um, she was like, "You're doing all this stuff." So I was new grad, and I was running the lab, even though I was like new, but I was ordering supplies. I was teaching dental student, and these are not dental students that are starting their programs. These are dentists that are coming back for specializations at UW, like surgical and this and that. And the lab that I worked in, we studied nerves and teeth. And so we did a lot of research using like mice and rats and stuff like that. So some of them will come to do research projects. So I was teaching them the project, like the research side of things. I was able to collaborate with another lab, and I did all the genetic stuff because that was my background. But I was only a bachelor's level, so I was like doing the lab,
Yeah.
but I also did stuff like washing
Uh-huh.
the because it was a small lab. And it was really interesting because when I got laid off, when that grant money ran out, my boss had set up for me to interview at some other places, and and those bigger labs that had more funding and multiple grants, me being a bachelor's level, and at this time I think I had about 3.5 years experience, like full time plus my undergrad experience. Um, as a bachelor level scientist, I would be like a human robot, especially in the labs that did genetics, where I would just like take a tray, pipette, 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 and then put it in a machine, press a button, and then go back and pipe it. And I was just like, to come from being in a lab where, my boss invested in me, she sent me to lots of different classes that, help my personal and professional stuff like Photoshop. And I got time off to take classes that ended up being my prereqs for nursing school, like anatomy and physiology and stuff like that. Um, and so that was great. But back to that mentor, she was like, "You're doing so much." She was like, "You shouldn't be like a level one. You need to be like," she started like looking through, and she was in a different job classification because she was a PhD scientist or whatever. And so I think I was a research technician or something like that. She's like, "Oh, look, the pay for research technologists is higher. Like, you need to tell you need to talk to your boss and tell her blah, 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 our boss." And I was like, I was a little nervous at the time because, I was like 22 years old, 23 maybe. And this was like my first real job. And it was a great job as far as like, I worked for the state, I was getting retirement. I had, vacation time, sick time and all that kind of stuff. The pay was very low. And so she's like, she kind of coached me and stuff. And she's like, "Okay, this is what you're doing. This is what you're doing." So I went and talked to my boss, and I was nervous, but I had my little list of things, and she goes, "Oh, yeah, we could switch you over to that." So that gave me a
Easy
raise.
peasy, right?
And it's like, "Why did I do this sooner?"
One thing I'll say too, like if you ask for like a raise or ask for something, right, they tell you no. I mean, do your best to make them tell you why not, or if, or at least what do you need to do
Right.
for them to say yes, right? Just don't take no, no. They should be able to tell you why not, and what steps you have to take.
Absolutely. And a time frame too.
Yeah,
So
that's a good one. Down frame too. Yeah.
yeah. So if they say like, the budget is blah, 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 we're at the end of the year, yada, yada, yada. You say, okay, so 90 days, can we reach, or whatever, try to get a time frame. I'm really big about, sometimes this annoys me. I'm a like process type person. And so when you give me a task, my mind is already running on like, okay, we need to step one, step two, step three. And what are the time frames and that kind of stuff. And um, okay, maybe you can't do it now. And also, like I said, don't wait till you're in this like stressed out position where you're just like, I hate this job. F you, F these patients. I'm getting out of here. This travel nurse over here is making 2, 3 times as much as me, and I'm just sick of it. That is not a good time to negotiate. Um, again, you as employees, we are worker bees for, our boss, for the bigger company that we work for or whatever. And so we need to be a value add. And, if you're running around with the stank attitude all the time, that's even if you're doing all the things, it can be really challenging too to sell yourself in a promotion when they're like, you don't get along with anybody. So, take that feedback, try to be open and receptive because sometimes you think you're doing a lot and your boss may say, you know what, actually that's the job description.
Yeah.
You're doing, and I get that you're coming every day. And some of your coworkers are calling out, but you're doing the job like the minimum, right? And so compared to them, yeah, it's a lot. And I appreciate that. But like, I can't promote you based on you doing your job roles and
So
responsibilities.
that goes a theory I have, and let me know if you agree or disagree. Right? So my theory is like this is a generalization again. Like suppose two people getting paid, we'll say 50,000 a piece, right?
Mhm.
One person gonna be like, I'm gonna pay 50,000. Man, I gotta prove to my boss that I'm worth 50,000. Like I gotta do extra stuff. I gotta prove that I'm worth this money. Like I need to do more stuff, right? Other person, I'm only getting paid 50,000. I'm only gonna do what I gotta do, right? And then, like you said, the person who's getting like doing extra, they get promotions, more training. And one only like I'm only getting paid 50,000. They do less and less, and they're like wonder how can they get promoted.
Yeah, entitlement is very real. There's some generational things too, as our workforce and workplace is changing. Workers are in general getting younger, although we still have people that aren't able to retire for different reasons. Um, and so, we have to rethink things that we take for granted, like work ethic and stuff like that. And there's a lot of talk and movement towards work life balance, right? And what does that mean? And for some of these younger generations, work life balance means I'm at work the least I can, and I'm out living life the best I can with the money that I make. I'm here to get money to do the things I want to do. Where in some older generations, it's like you have to go to work. Like there was no other option, right? Like nobody's going to take care of you. Nobody's going to, um, you know, uh, pass you on to the next step. You got to do it for yourself. And I don't know, I don't want to say one way is right or wrong, but I know that they can cause a lot of frustration between generations, when it seems like, well, they're always playing and I'm doing this. And, what do you say? Comparison is a thief of joy. And I think that can be very true. And we don't know everybody's situations and circumstances. So sometimes some of the people that are coming to work and they got this big smile and they're like, so gregarious and getting along with everybody, and you don't know the battles that they're going on at home, and maybe they have to put that face forward. That's their work armor that they're because if they didn't, they would be breaking down crying every day at work, right? And so we don't know. And like I said earlier, people, especially with the pandemic, it has revealed a lot of things that have been problems, especially in healthcare. I honestly, in the next 5 years, we are on a trajectory for nobody to get healthcare, honestly. People aren't going into medical field, they're not going to nursing, they're not going even into, like, MD programs, right? Like, in certain specialties, especially primary care, because it doesn't pay, it doesn't reimburse, long hours, 15-minute appointments, like, primary care providers are burnt out. And so if nobody's coming to relieve the people that are gonna be retiring, the people that are leaving the field, including younger people that should be, taking over for those people that are retiring, what are we gonna do?
Yeah, I think it's always funny. Like each generation, they believe the generation that came before them are the cause of all those
Yes.
problems, and the generation coming after them are the laziest people on the face of the earth, right? But your generation is always perfect. You saw all the problems. You had the hardest work ethic. It
That's
doesn't
right.
matter. Like here now, like I think it's millennials and Gen Z What's the one after Gen Z? Is it Gen A?
Alpha.
Alpha.
Mhm.
I remember like Gen Z complaining that Gen Alpha is the worst one ever. Like,
Right, right.
you don't remember a few years ago they were
Yeah,
saying the same thing about you.
got you.
So the lack of medical care coming up, do you think that's where AI comes in? Like, like AI, doctor robots and stuff like that, telehealth comes in. Like, would you trust a AI that I hear like AI is like they're like not caring, but like they're like seeing like cancer coming on, all this stuff they're doing. Think that's a solution? Or do we need like a human to human touch?
It's a that's a multifaceted question, right? I love technology. Like I said, I've embraced a lot of AI technology. I play around with Midjourney as a creative outlet, making images, using Chat GPT for different things. And I think they're great tools. I don't, they're not to the point where they can replace people. And the thing too is, um, AI currently, has to be programmed by people. And so AI is not perfect. There's lots of biases that are built in, especially when you look at the demographic of who's programming. And that's here in the US, especially, it's predominantly white males in kind of that type of tech field and stuff. And so um, we're going to continue to see the same type of problems, even with AI, which has, been over, uh, different articles in the news. I won't say the news, but like in articles and stuff about, is AI racist? Well, yeah, yeah, it is because it was programmed by people
You
that
have all the facial recognition problems. There's all these HR recruiting AI apps that are being like proven to be biased.
yeah, yeah. Because again, the people that program it, we want to think that computers are like unbiased and they're just like perfect,
It's
and they're
also
not.
it depends on the code, right?
It does. And even like Midjourney making images, text to image technology. I was an early adopter, and like you when you put in like woman smiling, it would always give you a white woman. It would never automatically, you'd have to prompt it and say, Asian woman, or, Japanese woman, or African American woman, or whatever. Because it wouldn't default, like the default was white.
Yeah.
What. And so even now, somewhat better. And then the first generations of, brown and black people were terrible. We didn't look as realistic and all that kind of stuff. But it's come a long way,
Yeah.
and now, you see a lot more, but you still have to prompt specifically for like different, ethnicities and things like that, skin tones. It doesn't like default to that. So there's a long way to go. I think as a tool, I think it can help with a lot of things. I think that there is a lot of cool technology that's being developed that can help augment real life providers. I think telehealth is amazing, and it's sad that it took the pandemic for it to really blossom. Some of the challenges, especially for telehealth, is that in healthcare professions, um, you usually are licensed for a specific state. Like here, I live in Washington, so I have a Washington nursing license.
I didn't know that.
Yeah.
I
And
know.
so even though we had to take a national exam called the NCLEX to become a registered nurse, my license is through my state. Now there's, especially since the pandemic, there's been a movement to do what they call compact agreements, where multiple states say you can, like, we're in agreement together. And this was because different states had different,
So how do these travel nurses go everywhere and practice medicine?
they have to get nursing license for all those states.
Okay.
So that's an additional cost. So like
Okay.
when we say, oh, they're making all this money, but this, like, they have expenses too, right? They have to get a license for that state.
Yeah, they pay for their own travel, own like all that stuff.
Yeah.
Okay.
Yeah. And so they get, like, for housing, typically they do get there's ways that they do like stipends and
Like
what's that
per
other-
diem.
not really per diems, like for food and stuff, but like for housing. There sometimes it's the way that they can structure is like more tax free or something
Yeah.
if you're uh certain distance from home and all that kind of stuff. But that also means you have to maintain two households when it comes to tax time. So um so yeah, so some of the states are doing these compact licenses, um, so that you can practice within multiple states. Um, and that's the same thing like mental health providers, physicians, this and that. Um, and each state has had different requirements. So even like as I'm getting ready to move into a nurse practitioner role, here in Washington, we have nurse practitioners have full practice authority, so we can see patients completely on our own. We don't need a physician to sign off. We have full prescriptive authority, which means we can write our own scripts. We don't need a physician to sign off. In some of the states, especially like in the South, in California, there has to be physician oversight. And you can argue for cons, whatever. But when you look at nurse practitioners as a whole, we have great outcomes and, you know, comparable things to physicians. But during the pandemic, it was like you have a pulse, you're breathing, whatever. Like you can see a patient, right? Like you're at work, like we are upgrading you. So a lot of those states that didn't have full practice authority, they were like, oh no, like during the pandemic. And so some of those states have tried to repeal. Some of them have moved in the right direction to allow more practice authority for nurse practitioners in those states, because the bottom line is we have a lot of people that have a lot of health needs, right? And again, people are not going into healthcare because they know it's long hours, it's stressful, the pay is when you add everything else into it, it's not super great. Um, and you know, a lot of people that like I've talked to a number of like physicians and nurse practitioners and other people in healthcare, that especially ones I've been in for a long time, and almost none of their kids are going into healthcare. They're like, oh no, I see how much you sacrifice. I've seen how a toll was taken on
And
your.
part of it too is like the insane student loan bills, right? Too, right? Like the same medical bills you got to, I mean, student loans
Yeah,
you got to pay, and then
yeah.
like pretty much like what's called the residency, like much
Hmm.
like working like 97 hours a day or something crazy like that. Like it's not a like a
It's not glamorous. It's not like TV,
no.
and it's very expensive. School is very expensive. And when
And
you
plus you gotta like I'm sure the medical school doesn't teach you how to be a business person, right?
no,
Like all the potential lawsuits, you got to deal with the insurance companies. Like it was
yep.
just like being a doctor. That's one thing. But it's that being a doctor and then all the other crap you got to do.
Yeah, and that's turning a lot of people off, different seasons of their career too, because, people come into healthcare because they want to help people. And somebody had just sent a meme actually in my nurse practitioner student group, and it was like, I became a doctor because, or no, I went to health. I don't think it's a doctor because I want to help people. Then you realize you're just a cog in the system of insurance or whatever. And, a
There's
lot
a
of,
thing for HR too. The thing is HR. I joined HR because I like people. I
mhm,
quickly learned that no, I don't like people.
yeah, yeah, it's really challenging. It's a hard sell. It is a hard sell to say, "Yes, go to all this school, take really hard classes. You're gonna cry, you're gonna sweat, you are gonna be so sleep deprived." In the last 4 years, I've averaged about on a good night, 5 to 6 hours of sleep, and part of that's because I have a now 4-year-old. So, had Lola end of 2019, went back to work in January. Then the world fell apart in March, and I was just kind of getting my groove of being like a mom and commuting and having a newborn and all that kind of stuff, or a little baby, And then pandemic happened, and I was really scared about bringing something home to, my, almost 70-year-old mom
Yeah.
who was taking care of my daughter and my, daughter and stuff. And but the travel nurse salaries and stuff, I was like, oh, maybe. I mean, I thought about it because I was like, "Oh, man, I can pay off so many bills and get ahead," and I could have, but for me, I the risk reward that,
Yeah,
yeah, I could make money, but I could also die, that
yeah.
I was like, "No."
And so you graduated in May, right?
Yeah.
So when you graduate, have you already started looking for a better job, like equal to your degree? Or was it VA, or you said, hey, once you get a degree, we're going to give you a better job? How's that work? Or is it like
I've
what's that process?
Yeah, no, they don't give you anything, just like we're talking about, like, negotiating, you have to ask for everything, so I made it known, I'm actually have been doing clinicals at the VA. I was able to get approved for a special program to still be an employee and have a separate, non-paid, like, clinical rotation. So I've been in primary care down at American Lake for the last, 2 semesters, and I've been letting them know, like, I wanna stay on, I like working with veterans, I would love to stay in this clinic. Um
However, show me the money.
well, yeah, show me the money. I will do alright if I get hired as a nurse practitioner
Uh,
because it's 10 years actually this month that I've been at the VA. I was a federal employee prior to that. Um, but, there's a hiring freeze nationally, so I'm not sure what's gonna happen. How We don't know how long it's gonna be.
Would you consider going like to a private hospital, like Swedish or Harborview, or like one of the one private hospital in Tacoma?
I would consider it. I'm open to all options, so if
Yeah.
there's any, like, recruiters or anybody that has a job for me, hit me up. But, I really I like especially what I've learned, about the insurance side, being in the federal system for so long, I don't really have to deal with the insurance part as, like, a healthcare provider. I do a course as a private person with my family and with me, and that's challenge enough. But seeing how much time you have to take to get reimbursement and all this kind of stuff from insurance companies has really turned me off to like outside, where I see, the VA has challenges and nothing's 100%, but in general, the people I work with and the people I care for, I really enjoy. And there's a lot of opportunity in the VA. That's why I've stayed there for 10 years. Because when living down in Tacoma and working up here in Seattle, I told my family, okay, I just need to get like 2 years med surg experience now that I have my BSN, my bachelor's in nursing. And then I'll be able to work wherever. And then I started getting promoted and got a lot of opportunities. And there's a lot of like, we do a lot of training that is not necessarily required outside of I'm finding, both to learn about, working with the veteran population. We do a lot more like diversity training than I found out my counterparts in this area don't do, which I was really surprised because my project, my like graduate project, capstone kind of thing, um, I'm looking at cultural aspects of care and pediatric palliative care. So I've done deep dive in the literature and stuff. And I was really surprised when I was talking to my coworker, especially um, after 2020, because we started school summer 2021. And I was like, you guys haven't been doing diversity training even like post 2020? And they were like, no. And I'm like, oh, because especially working like with active duty folks, we're always doing like training for sexual harassment, for diversity, da 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 da. And sometimes you're like, oh, somebody got in trouble. That's why there's more training, right? And then coming over to the VA, we have to do a lot of stuff yearly. Um, and so I was really surprised. I was like, you guys haven't done like one diversity training since all the stuff, with George Floyd and all the like racial, civil unrest across the US. And they said no. And that really shocked me.
So on your, I think there's a bio you sent me. It says, I'm passionate about patient-centered care. I mean, I thought all care was patient-centered, right? So is that a wrong perception on my part?
I mean, if that is your perception, if you've gotten to your age, then I think you've had some really good providers because it is not always that way, unfortunately. And we talk about systemic racism, in the US and in healthcare and things like that. It's really we all have our own biases. There's that implicit bias test, I think, from Harvard that you can take online. And it has different categories. Like some of them are, race, gender, even like socioeconomic status and things like that. And we all have our biases based on, how we grew up, the experiences that we had, the people we've been around, the education that we've had. Um, and it can be really challenging if we don't check those beliefs that we have because they're not always true. Just because I believe it doesn't mean it's true, right? And so, especially in the medical field, it tends to be a hierarchy where the provider is at the top and they're telling you, and that's, you know, based on kind of how the medical profession came to be. Um, if you look at some of the quotes from Hippocrates, they're kind of wild about like this is not a direct quote, but like the patient's like a basically like a child, and you have to direct to them their care, and that you should keep things from them because they won't understand it. And so, if that's kind of the father of modern medicine, that gets put into the curriculum, even though it's not like in your face, right? And like the oath is like do no harm. But if you don't realize you have these biases, uh, then you can be doing harm unintentionally, right? And so a lot of times, so even in some of the family meetings that I've been a part of, being on, the healthcare team side, I've also been on the other side as the family member. And that has given me a different perspective of what it feels like to be on the other side. I think a lot of times with healthcare professionals in anything, we have our own language, right? We have our jargon. We have things that we're doing every single day. And as we were talking about earlier, we can compartmentalize some of that stuff. Um, and it gets to the point where sometimes we have to close off parts of ourselves, sometimes that compassion, sometimes that grief or that loss, because we have to keep going and we have to take care of the other patient, even though this patient just died. And so sometimes that gets the right word, that makes us kind of hard in our shells, right? And so sometimes we don't relate to patients, especially when they maybe don't look like us or they don't sound like us or they're cussing us out. And sometimes it can be hard to see the humanity in a person when you don't necessarily feel like you're being treated like a human and you're superhuman, right? Because you're a nurse and you're working 12 hours taking care of all these people that it's not always patient centered. Sometimes it's about my needs or what I think is best. And, sometimes I challenge when I'm part of the healthcare team, like, yeah, we can give our professional recommendations, but we have to have shared decision making with the family for them to decide. The patient, has their mental capacity to make the choice. We may not agree with it, and we can tell them we don't think it's safe. Especially in the rehab setting, we don't think it's safe for you to be home without 24-hour supervision. But they can say, you know what, we want dad home, we want whatever home, and we can be home 16 hours a day, and that's the best we can do. And that may horrify us as providers because we know what can happen in those 8 hours that person's unattended. But in reality, I always say, like, if that was your family member, can you all of a sudden do 24/7 care? Does your parents, do they have the resources to pay somebody else to do that? Are you able to quit your job right now and be at home with them? No. So we also have to have some compassion when we're giving our our professional recommendations and say, this is my recommendation based on XYZ, but how can you guys work together? How how can we figure this out? Not just like, oh God, no, you can't do that, and like put that such hard judgment based on us as like professionals in our training saying, oh God, no, you can't be home alone, by yourself, which, is probably true. And they may end up in the ER in a week or two or whatever, or they may not, they may thrive or whatever. And maybe the family can figure out some alternatives. But it's very easy as healthcare providers because we have such education. We've had so many experiences with other similar families or whatever to say, this is what's going to happen. And that is not conducive to a good patient provider relationship. And I've been on the receiving end of being told very specific things were going to happen that didn't happen. And that made me lose trust in my provider. And that's not a good relationship.
So you did another Medium article on setting goals as a healthcare professional. Can you talk about that?
Setting goals. Was it professional goals?
Yeah, setting goals as a healthcare professional.
Jason just Googled me up.
Yeah.
Okay. Yeah, I think I am a goal-driven person. I know
So,
that.
quick question:
Mhm.
why do you think some people are like goal driven, some people are not goal driven?
I've always just been goal-driven. It drives some people crazy. I actually had my mom say to me a couple summers ago, like, "When is enough enough? Like, you're always like, you're getting this, doctorate degree, blah, 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 and now you're talking about this, that, and the other thing."
And the answer is it's never enough, right?
And I was like, it's not that I'm not satisfied, like, I have a good life, but at the same time, I'm here on this earth, and another lesson that my dad kinda taught me was that you only stop learning when you die.
Yeah.
And so I've just always been fascinated with learning things, doing something new, and it's not that I'm not satisfied, that's just how my brain works and
Yeah.
how I
I'm the same way.
how I like to. I don't know, it's that's what's fun to me, right? It's like learning new things, discovering new things. And so I think people have different personalities and it's not right or wrong. Sometimes it can be frustrating when you're a goal driven person and somebody else isn't, or you're a hard worker and you perceive the other person not to be a hard worker. Um, but there's a lot of data that shows that the people that actually like write down their goals, not just say, oh, I want to lose weight, right? But they write down their goals, whether it's at New Year's or some other point in time, they're more likely to actually achieve it. And so there's some kind of connection, mind and like body, with like physically writing stuff down and making it real, right? Because if it's just a thought, it's here today, gone, gone in 10 seconds, right? But when you start writing down your goals and being specific, most people have heard kind of that acronym SMART goals of
Mhm.
like
Yeah.
um, making it specific, measurable, actionable. Or
Not relatable, is it?
I
No.
think it is relatable.
Relatable?
Is it or realistic?
Realistic,
Realistic,
realistic.
and then time driven. So you're saying, instead of just saying, I want to lose weight, you're gonna say, I'm gonna lose 20 pounds in the next 3 months. And maybe even adding like what your goal is because I have my high school reunion or because, I want a hot girl summer or whatever it is, So those are more likely, especially when you write it down, because if you're thinking of all those specific things, it's not just going to be in your head. You're going to write it down. Um, People are more likely to achieve them. And I think, you know, we all have autonomy from the time we're basically born. We want to be in control of ourselves, even though we physically can as a baby, right? Because we see as soon as kids start talking, when they're like 1, 2, they're telling you no, they're, making their needs known. Um, and so we don't like being told what to do, even when it's ourself telling us. And so I think that's why some people maybe don't want to set goals, um, because there's a fear that, well, first of all, we don't want to be told by anything, by
Right.
anybody, anything. And then there's also like a fear that you're not going to make that goal.
Yeah, I think it's a big one too. I think people don't set goals because they think or they know ahead of time.
Right.
If I set a goal to lose 30 pounds in 2 months, there's no way I'm gonna make it. So I'm
Right.
not even
Because that's
try.
not even a realistic
Yeah.
goal. And back to that SMART framework, like it should be realistic, right? So, you didn't probably gain 30 pounds in 2 months.
No.
So
Well, hopefully not anyway, right?
I mean, it does happen. It does happen, but if it did, there's probably some kind of medical thing going
Right.
on. So, yeah, I think a lot of people have a lot of fear. A lot of people do live in fear, whether that's not living up to their expectations or their potential, and a lot of people would just rather be complacent and not even try.
Yeah. So it says your current research interests are health equity, cultural aspects of care, pediatric, palliative care. I probably said that wrong, and improving health outcomes experience. Can you like focus on one of those and why you're interested in it? What drives you to pick that certain research topic?
So I mean, there's lots of things, but I specifically want to help like underserved people who haven't had a seat at the table, people who look like me, people who have had poor healthcare experiences. I've had poor healthcare experiences, and being like the person in the medical field in my family, my husband's family, I go to a lot of, you know, um, when people are in the hospital or people have questions about appointments. I use my education and the resources and things that I've studied so that I can help them, right? And so, um, you know, part of part of the reason I did go back to school was that, I can give statistics, I can write papers, I can complain, I can talk to my peer group that have also had poor experiences, but I want to be part of the solution too. And so, I'm very fortunate that I had the opportunity to be able to go back to school. I know that I have privilege, right? Even though, being a black woman in America, there's lots of not privileges. But I also was in a position that I was able to go back to school and pursue a doctorate degree and be the, first one in my family. So I don't take that lightly at all. And so, like I said, want to be part of the solution. So I was like, you know what? I have the opportunity to go back to school and be a provider myself and be part of that change that I want to see. And, I know that part of that is, I like patient care, um, helping people on the individual level, but also having a doctorate degree gives me a little bit more oomph when I want to help get legislation passed to help, improve the healthcare system and improve health outcomes and things like that. And so, um, yeah, I wanna, like, help people, like I said, I try not to gatekeep information, I do have my little blog that I've been putting health information and stuff as I'm able, because again, time is limited, but, I can't tell you, like, even in the last couple months, I have helped, and I'm not saying that I'm not a, like, braggy person, it's just, like, I have helped people with trying to find caregivers for, a family member with dementia. I've helped um, answer questions about a diagnosis. I've helped, and this is like friends and families that have my number that call me up and, ask about their kid's medical condition. And not that I'm the expert or the guru, and I'll even tell them like, hey, you need to go to the doctor, right? And that's my answer. But I can also help translate stuff because I have that education and experience that when I hear certain buzzwords, I say, "Oh, don't say that. Like, you need to say it this way, right? Because if you say that, they're gonna be being in the medical profession, I can translate and say, they're gonna hear it this way, and that's not what you mean, right?" And so I feel very fortunate that I'm in that role, to be able to be that person, and like I said, be part of the change that I wanna see.
And so you said you grew up poor in Tacoma, right?
Yeah.
So you grew up like so let's say like an economically disadvantaged neighborhood.
well, Tacoma is
Oh, so, I mean, yeah.
close to Tacoma, south end of Tacoma. So,
Okay.
yeah.
And so what do you tell people who are like out there, like, obviously like you made some for yourself, right? Yeah, like you have goal driven, like
Mhm.
you're starting to live in the, you're not like a high school dropout, like you doing your goal driven. What do you tell people who are like, the man's against me, I can't do anything, and then you do some research, like what have you done? They've done nothing, right? Like, do you like try to encourage them, like, hey, you still like make it on yourself? Yes, the man's against you, quote unquote, but the man can't stop you. Like, how you like motivate people, like, get out, what's it like, get around that cycle of like, like distraught and like no one can help them.
Yeah, it's hard, when people everybody has a different personality, and I realized I used to always think like, if I can do it, anybody can do it. I mean, until like recently, and I was like, I still think anybody could do it, but I realized that most people won't, right? And, like I said, I've been working full time, going to school full time, have a house, have a family, have a kid. So I'm like, I feel like anybody, if they want to, can do it. And I do have a lot of support. I have, because I'm a Tacoma girl, I have, my parents and in-laws and friends and family that have helped out and stuff like that. Um, but it's really hard. Like, you can't make anybody want to change, right? And I think that in some ways, when we elevate ourselves, we can help inspire people. I think tapping into younger people, a lot of times is more fruitful, because sometimes older people get into their own heads and get stuck in the cycle where nothing's ever going to change, because it's never changed. And I'm whatever, 50 years, 60 years, 30 years, whatever, can be really challenging, and help the people that want to be helped, right? Because you can spend a lot of time, which I'm sure you've done. I have too, with people that you claim to you and they have all these complaints, they have these concerns. You're like, oh man, that's terrible. Let me help you. Right. And then you spend a lot of time, money, resources trying to help them. But if they don't actually want to help, and sometimes,
And they're done that.
right.
Yeah.
And sometimes they say the right things. And, I think trying to gauge like how serious and how much are they willing to put forward,
Yeah.
because you cannot put forward
Yeah.
more than they are.
And you come back up 2 months later and like they're even in the worst situation.
Yeah.
Did
Yeah.
you listen to anything I asked
And
you to
it's
do?
hard. It's hard, especially when it's people you care about,
Yeah.
people because a lot of times that's who it is. And I think, one of the other big things that we have to really, really think about where people are as far as like their mental health. It's really hard for people to move forward with whatever dreams or thoughts that they had if they're like battling depression, anxiety, or any other mental health things. It's like they might be able to go through some of the emotions, but it's not going to stick, right? And so, one of the things that I've really been, I didn't think I put on the list, but I took a last summer. I took a functional medicine certification, because I'm really interested in like what's the root cause of problems. Getting back to like even when I was a young girl trying to figure things out, and I just really like that approach. It's holistic approach, but they look at like when they do an intake for like a new patient with a functional medicine approach, they're looking not just at your labs and um, your blood pressure and kind of like those physical symptoms. They're also asking questions about like trauma that you've had. They're asking about life experiences that you've had. Because a lot of these physical ailments we're finding have a trigger that could have been like more emotional, or like something that, happened, right? Um, and I think too, with some of these generational things, when we look at like millennials and Gen Z and all that kind of stuff, they have grown up in a very just tumultuous time. There's been so much like,
They've gone through a lot of shit.
yeah, and
Like,
we don't give them grace
yeah.
like that. God, that like you were like we went through it too, but we were at a like an adult stage,
Mhm.
right? And for them growing up, like, oh God, like you didn't get to finish high school with like in person because that was a pandemic and stuff like that. Um,
Then all the economic collapses they went through, the
yeah,
wars, just yeah.
yeah. And so just a lot of unrest. So
Like I said, every generation goes through stuff, so
they
to speak,
do,
right?
they do. And it's not to say that that's like
It's not a
it
competition, right?
doesn't need to be a competition,
Like the
right?
greatest generation, they had the depression,
Right.
World War I, World War II,
Yeah. Yeah.
but it should not
There's
be a
challenge,
competition.
yeah, life is hard, and I think we just have to realize that life is hard, and you might be thriving, or at least maybe a lot of times we think people are thriving because they
Yeah.
have a great job, or they have
You
this
have no
or
idea
that.
what's in
They
the
have no
background.
idea. I know people that have known me for years that think I had somebody tell me recently that, you know, what did they said, that basically, like, I get stuff handed to me, and that anything I, like, put my mind to, I get.
Yeah.
And I just looked at this person and I was like, "But you're making it sound like I don't work hard."
Yeah.
"Oh, no, 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 that's not what I meant." And I'm like, "But that's what you said."
Yeah.
And it's like, so on the outside,
It's like
yeah.
that's exactly what you said.
And I was like, "Yeah, I have a good job, I have a family, I have this and that." But when you peel back the layers, and we're all multidimensional
Yeah.
people with lots of layers, it's like, I've been in this position because my dad died my senior year of high school, and it was a great dream of my parents. And I'm very fortunate too that I had a very good upbringing as far as my parents really invested in, and I was through public school and everything like that. But they were very big on education, education being the key out of poverty. And I also saw my dad going back to school, and my mom stayed at home with us majority of my life, but she was always at school. My parents, were very involved and stuff like that. But but on the surface, everything looks glittery. But I've had a miscarriage, I've lost an infant, you know, I've had all kinds of challenges. I almost died from blood clots. I've had surgery, I've had this, I've had that, and everybody has stories like that, right? But when we look at the outside and like
Yeah.
work persona
The
or
Instagram
social,
life.
yeah. And I don't post this regularly because I'm a fairly private person, but I try to be realistic. Like, of course I have makeup on today, which I don't usually wear makeup, but I was like, "Oh, I guess this is live, so I guess I should put something on." But you know, I try to be, I think there's a lot of power in sharing our stories too. And a lot of people, because of Instagram and social media, there's a lot of positives, and I'll circle back to that, but there's a lot of negatives too, right? When we see these really polished, refined, and the industry is kind of moving away from that. You see some of these big gurus in the different spaces, whether it's health or whatever, they're starting to do like more behind the scenes and showing their family this, where, a couple years ago, before the pandemic, it was more, you know, super glossy, super, makeup, and the guys are like with the sports car they probably rented and showing all this stuff. Right now, people are showing their families and how they're balancing and stuff like that. But I forgot what I was going to circle back to. Oh, about social media. There's really positive. So, me and my husband, our son Trey, we got diagnosed when I was 16 weeks pregnant with trisomy 18. We were told that we would he would not live. Like, I would miscarry in the second or third trimester. I mean, with no uncertain terms. That's what I talk about. This eroded the relationship I had with that provider, which I didn't see that provider anymore. 'Cause I was like, I need an A team. And our son was born. I was able to carry him full term in pregnancy, but we had providers that said, there's no way that, like, you should not even continue with this pregnancy, like, with no uncertain terms. Because he has this diagnosis. He's not going to live, and it's going to put you in danger because of your, risk factors and things like that. And it was like, whoa, not what I was expecting at all. And so that's why I'm really passionate about patient-centered care. And so they went off a bunch of statistics. And so statistics, you can say it's just like
So
with
it's
the
like
lottery.
they did a dinosaur almost like your number instead of a person, right?
Yes. And so, like, think about the lotto, right? We all think we're gonna win the lotto. I don't even play the lotto, but I'm like, "Man, I'm gonna win this lotto one of these days," right? I see the big, thing. So we all think, like, when it's something positive, we think, "Oh," even though the chances, in the small print, it's like 1 in, I don't know, 1,000,000 or whatever to win the big jackpot of lotto, we say, "Oh, man, I could be that one," right? And then when it comes to, like, negative stuff, we're like, "Oh, 1 in 6,000, chance of him being born alive." Oh, like, you know, we get on the negative side. But anyway, so, um, that's something that I'm really, like, passionate about, but also, like, sharing our stories. I was able to see Michelle Obama when she came a couple years ago, to Tacoma Dome, and she was talking about the power of just sharing our stories, because a lot of us go through life and we're just surviving, you know? And a lot of times we get stuck in our head and we think that we have it the worst, or we're the only one going through something. And when other people share their stories, and, sometimes it's not a positive story, sometimes it's just like what's going on. And you're like, wow, sometimes that makes you feel not so alone, or it makes you feel like, wow, if they could do it, I could do it. Or at least I could talk to this person,
Yeah.
right? I thought I was going through this trauma or this experience all by myself. I didn't think there was anybody like this. And now I know that I can talk to this friend about this. So I think that really was impactful to me. And so I don't always share it on social media, but I'm always sharing it with, like, people I come in contact, talking about trisomy 18 specifically, because that's what our son had. But talking to people and giving them hope. And I think, especially as I move into the role of being a provider, there's a way to give even difficult information in a compassionate
Yeah.
way that's not me-centered, because a lot of times we don't want pain, right? We don't want hurt. And so it's hard when you tell a person, "Well, you have cancer," or, "Your baby's not gonna make it," or whatever. And it's hard, again, if you're telling people that time after time after time, that you start building this
Yeah.
resiliency and building the shell. But I would tell you, being on the patient side of things, when I had a miscarriage, and I thought that's what I was having, being a nurse, and I had to wait till later in the day to get the ultrasound, and I went in there, and, the first person I saw was somebody I went to high school with, the nurse that checked me in. She just came and gave me a hug. This is before I even got the ultrasound or
Yeah.
whatever. She saw what I was in there for, and that was like that human to human interaction was like, "Wow, I'm not alone," because I had to go to that appointment by myself. And, then they did the ultrasound, and again, I already was pretty confident I was having a miscarriage, um, but need confirmation or whatever. And then when the provider came in and he told me, he teared up too and came and gave me a hug. I had
Yeah.
never seen that man before in
Yeah.
my life. And that humanity is like, what you want when you're in that kind of situation. That's the kind of provider that I want to be. And, yeah, I mean, never seen him again, but just at that moment, he was able to not just be like, you know, um, put on that, like, armor that we
Mhm.
do in healthcare, 'cause it does
Yeah.
take attacks on you, but he was able to have a human-human interaction with me, and that was so impactful even though I was through a horrible, experience and stuff. And so, I think sharing our stories, not to, and when you hear a story, not just to, like, say, "Oh, they're just trying to show off," or
Mhm.
"They're trying to get sympathy."
Yeah.
Like, just listen to it and see how you can
Mhm.
connect to it. We're all human having human experiences. Some of them great, some of
Yeah.
them bad, and just give people grace. Like I said, people are this pandemic has been the hardest thing a lot of us have gone
Yeah.
through. And I don't mean that, like, there's people, of course, that have had life or death, experiences and that kind of stuff. But like the sustained and everybody having this
Yeah.
experience is very different than, getting shot at one time and just you and maybe your friend had that experience, but everybody collectively. So there's not a lot of reserve, right? It's not, even if you go to a mental health provider, they're also living in the pandemic. You know what I mean? And so it's like
Yeah.
this
Yeah.
this thing, and so just giving people grace and having that human interaction and experience, I think is just so
So your
important.
son Trey, you were very public about it. You put on social media, you talk about it a lot.
After
Afterward, yeah, afterwards, yeah. Do you ever regret being so public about it?
Nope, I do it
Okay.
again in a heartbeat.
Okay.
Um, should have brought tissue. No, Trey honestly changed our life for the better and has made me a better person. He's the strongest person, even though he only lived to 4 months I've ever met or encountered. And he had this inner peace. And he was actually an easier baby, even though he has some medical issues, than Lola, who is such a joy and such a, uh she has such a strong personality, but he was just like peace. When he was first born and they brought him up to me because I had a C-section, and he just looked at me, and it was just like I literally had this, like, sense of peace. And, when I was pregnant, I didn't share it because we had had a miscarriage not that long before that, had a bunch of testing and stuff. And so very few people knew. I actually miscarried on our anniversary. So it was really a lot. And when we got pregnant with Trey, I was like, I don't want to tell anybody till we're like past the first
Mhm.
trimester. And so everything had looked good. I had lots of early ultrasounds, lots of early testing with him. And then we happened to get genetic testing done because I literally had money left over at the end of the year in my flexible spending account. So it was like, oh, why not? And then we found out that he had trisomy 18 right in between Christmas and New Year's. And we had just told a lot of our family that we were
And
expecting.
that's something that comes from genetics or just like a random
It's
thing
a
that
random thing.
yeah.
So the most common version, trisomy means you have 3 copies of a chromosome instead of 2. And so the most common trisomy is trisomy 21, which is Down syndrome. Trisomy 18 is the second most common. Um, and so that's what Trey had. And then trisomy 13 and then 9. But you can have 3 copies of any chromosome. Um, and so most often it's not a genetic, like, passed on. It is related to your genes, but when the egg and sperm come together and it's duplicating everything. Instead of just making one copy, it makes two, or sometimes, or sorry, for a total of three. Um, Sometimes it'll make just part of it. So that's partial trisomy. So maybe you can have partial trisomy 18 where you have two full chromosome 18 and then part of another one. Um, that's very rare. And then there's mosaic as well. But the most common is when it's just like a copying error. So instead of making one copy, it makes two and you have three total chromosomes. And it's not something that's genetics. It's random chance.
And I'm
So
guessing there's no cure for this.
no, there's not a cure. But the
Okay.
thing is, a lot of the research, unfortunately, that the providers still reference, and things are changing. Even, Trey was born in 2018, and I'm really involved in a lot of the trisomy like family support groups, which were a godsend. And, oh, that's back to social media can be really great because we were able to connect with other families that actually had kids of all
Yeah.
ages with trisomies and find out what it's like day to day, find out what tests to ask for and all that kind of stuff, where the providers were not even giving us hope, right, at the beginning. And so social media can be great. You can find somebody that has your interests or has your medical condition, and not that that's 100% everybody's individual and unique, but it can give you a lot of support. Because it isn't it more support to hear from somebody who says, "Hey, I have a 4-year-old that has trisomy 18, and this is what our day to day lives like,"
Yeah.
versus somebody who said, "Well, you're going to miscarry, and he's not going to be born to term," and then he was, right? So, yeah, I wasn't really public about it to begin with because it was just so much that we didn't know. Um, our small circle of people, and even with them, they were asking
I
us.
guess I remember it wrong. I remember like you be like not being like overly sharing, but I remember you like posting a lot about
I
it.
did tour, yeah,
Or was it
like
afterwards?
no, no, like so I didn't like I honestly didn't know if I was gonna carry to term. So like I was like, I don't even.
Because I want to say I remember a picture of you when he was born, of you all taking a picture like he was first born with everything
Yeah,
on your body. I
yeah, yeah.
remember that for
It
some
was,
reason.
towards the, so about 24 weeks, I think. I had to go get an echo, fetal echo, where they looked at his heart because a lot of kids with trisomies have heart conditions, heart defects, and things like that. And some of them are surgically repairable. Some of them they can just live with. It just depends. But a lot of hospitals, I found out, will have policies that say they will not do surgery on kids with trisomy diagnoses, which is not fair because there's a whole spectrum, just like with any other disease or condition, where some are a little bit affected, some are moderately affected, and some are really affected. And so they'll just make this blanket statement, we're not ever going to do surgery on a kid that has a trisomy, is not right. And so I know a lot of parents that have gone out of state, taken their newborn child, or some of them have even moved before they delivered because they knew that their local hospital wouldn't do surgery, and got heart repair surgery. And that's ridiculous. We live in America with the most expensive
Yeah.
healthcare system. And if we're not willing to help infants, like, where is our humanity? And so yeah, as so after like 24 weeks, I got the fetal echo and they said, "Oh, his heart looks good." And we actually went up to Seattle Children's, who absolutely love. And that was the first positive, so I was like at 6 months pregnant and they were like giving us positive. They said, "Oh, have you picked out a pediatrician?" And we're like, "What?" Like, everyone's telling us like he ain't even gonna be bored. Are you kidding me? And they were like, I remember the social worker. She was amazing. She just was like, um, she said, "No, you need to pick. You need. I think you're gonna take your son home." And then the cardiologist had said that too. Me and my husband were just looking at each other. What? Like, we didn't like. It was such a stunning moment, um, and so we're like, okay. And then, that gave us some more confidence. And then when I had a pre-care conference before I delivered, I was probably about 30, 28, 30 weeks. Because I delivered at St. Joe's and they were amazing. Um, I had said, "Oh, they keep saying that they can't see if Trey has a stomach, and that seems to be a concern when I'm getting all these ultrasounds every month and all this stuff." And the doctor said, he goes, he was just so matter of fact. He was like, "Your son has a stomach. He absolutely does because your amniotic fluid, blah, blah, blah." He just like, and I'm like, "Okay," because literally every appointment they've been like, "We don't know if he has a stomach, da 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 da. We can't see it, da da da." And he was like, "Oh no, he has a stomach." I was like, "Oh, okay." And and so I asked him if they felt comfortable delivering, Trey, because at that time it was like either deliver at St. Joe's where my A team was, or deliver possibly at UW. And I had, even somebody in medical, I had concerns being at a teaching hospital because I also didn't want my child to be like a class project.
Yeah.
And so, and also we have a lot of support here in Tacoma, and UW is North Seattle, and that's kind of far away. So, um, when I had talked to my OB, she said, ask them straight out, like, do you feel comfortable delivering, caring for my son? And if they have any hesitation, then you go up to UW. If they don't, and so Dr. Welty was like, who was a neonatologist that was at the pre-care conference, he said, absolutely, I would love to take care of your son. Okay, so we're delivering. And the I don't know her exact title, but the front office person was somebody, like, when we actually delivered, she um, was like the mom of people we went to high school with and stuff. And like the NICU and the Family Birth Center staff were amazing. And I actually, after Trey passed, I volunteered there for a year, giving back. And when I had Lola in 2019, the NICU nurses came down. My provider, who had left but still had privileges at St. Joe's, came and was there for the delivery. And so, making these connections, everybody is people and humans. And I think when we can take an extra moment and connect with people, we're all so busy and we're all go, go, go. And I'll say, I spent the month of January in Oaxaca, Mexico for a study abroad. Um, and it wasn't part of my program, but it was an opportunity that came up. And I speak very, very little Spanish. I was trying to do my Duolingo and all this stuff. And I understand a lot more, but being in a country where, when I say I grew up poor compared to there, no, right? Where we were in a lot of rural areas, but the people were genuinely happy. And they were inviting us into their homes and cooking for us and teaching us about their culture. And we learned a lot about some of the indigenous communities in Oaxaca. Uh, and it was an amazing opportunity. I'm so glad I had that opportunity. And it was, um, it will make me a better provider, right? Because being in a foreign country, not speaking the language, I can now relate in a different way to patients, right? And the other big thing for me too is, like, even though I had very limited Spanish proficiency, with Google Translate, my notes, and just like having humility and starting out, like, telling them I speak very, very little Spanish. I'm like, muy, 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 poquito español. Get a little laugh from them. And like, if somebody spoke some English, like, they might help me out, but we got it done. And so, I was like, wow, even one of my classmates that was on the trip, who is fluent in Spanish, because I was doing most of the well child checks, I was away from the other group. So it there was not a translator. There were people that could translate, but you had to go get them. And so I'm gonna get the mission done, right?
Yeah.
And so, we were able to work together. And so that gives me more confidence too, that if I'm working with patients that don't speak English, that I can still get things done while we're waiting for a translator, or, by just showing my humanity, being, humble, um, and letting them know I'm gonna take care of them. I think that does a whole lot.
So you have an older kid, older than Trey, right?
So, yeah, so, my oldest bonus daughter is 20, and then second, bonus child is 17, gonna be graduating this
Okay.
year, and then, me and my husband had a miscarriage in 2017, and then we had Trey, and then Lola's 4.
So the two older kids, what the process of, like, did you tell them everything about Trey? Like, give them like piece of information, or like, because I mean, they're not like they were like little kids; they were kind of older,
No,
right?
they were yeah, teens. So, yeah, we were pretty honest and transparent. Um, I try to be pretty
Yeah.
transparent with stuff, and I think kids are really smart, and when you keep things, they know something's going on. And so, yeah, we did talk to them and let them know that we just didn't know. And there were some books that we were able to find that we kind of read, even though, like, we got a young kids books, and just said, we don't know. And um, both both kids were very involved. They both love Trey, and they were the best big sisters to him and adored him, and he adored them. I don't know if you've seen some pictures I posted and stuff, but they they had a very special relationship. And we were told, that Trey probably, by some of the negative Nancy providers we saw, you know, basically he could be like a vegetable, right? And he had such a personality, and he had different noises for different people, and he was a very calm baby, and he loved his big sisters and to play with them, and um, like I have pictures of the oldest that I didn't even know she was taking out his picture. She lay down with him, and she's doing like those duck lip like,
Mhm.
and here he is doing the same thing. So they had a very special relationship, and it is very hard for them to lose their baby brother as well.
Can you talk about Trey's coloring adventures, 25 original theme coloring design for adults?
Yeah, so, when, after he passed and I was trying to find meaning in life and decide if I really want to stay a nurse because it was really hard, um, so I was just trying to keep myself busy with lots of stuff, so I was volunteering. Um, I was actually at that time, I didn't even know if I wanted to stay a nurse, and, um, I was just, like I said, I like tech stuff, so I learned how to do, like, self-publishing on Kindle and created a coloring book because coloring is also one of those things that you can um, to show, to reduce stress and, put you in like a more peaceful, calm zen. And so, yeah, I created that coloring book like in his honor and just as a something for me to do um, because to go from being a medical parent where you're dealing with insurance companies, caring for your child, I was still early postpartum, trying to heal my body and all that kind of stuff. Um, to not having that is a big void. It's a big void.
So I think this is one of your research things you did. I have written this down. It says cultural competence and caring for racial minorities in primary care. Was that one of your research topics you did or something else?
Yeah, so in my program we have in order to graduate we have to do Doctorate of Nursing Practice project, which is kind of like a quality improvement project. We start doing different pieces of the project very, very early on in our program. And so I knew I wanted to do something kind of in the diversity space. So originally, I was looking at creating like a toolkit for primary care providers to have better communication with their racially diverse patients. And we had to do a poster presentation. So that's what that is related. So that was not an actual like research project that I did. Um, that was the first step of just looking at what's already available in the literature. And excuse me, I did that poster presentation at POU and then use pieces of that in my project I just finished and that I'm currently writing up and will be defending in just a couple weeks in April 24th.
So when
So
people like defended their dissertation, can anyone come see it, or is this like it's just you and the three
no,
people?
anybody. Yeah,
Okay,
and just a slight point of clarification, I'm not doing a, dissertation, it's a defense because
defense. Okay,
it's a little bit different. PhD programs, and I'll speak specifically about nursing, you create new research, new data, and it's kind of a long, convoluted, process, and a lot of nurses that, decide to get a PhD are not, wanting to do or they wanna work at a level that's not direct, like, patient care, whether that's, being in the education side of things, with research or whatever. But typically, PhD programs aren't necessarily to work directly. You're gonna work, like, research and that kinda stuff. And the reason I chose a DNP program, um, is that I wanna still work with patients, and, so with the DNP program, we're not creating new data. We're using available that's why we have to do such a extensive literature literature review too. We take something that's already kind of validated and, um, maybe do it in a different population or put, like, a twist on it to do, like, a quality improvement kind of working project that, can impact nursing care or healthcare. And so, yeah, so I'm not getting a PhD. I won't be doing a dissertation, but it's a similar process where I do have to go and do an oral presentation of my, project and, my findings, and anybody could come.
can you tell us what you're gonna be, what topic you're going to be defending?
Yeah, so, I I just changed the title of my project, can't remember the exact, title, but the title I'd had for, like, the last year was, "The Cultural Aspects of Pediatric Palliative Care," and that's still what it's in, but I've made a more specific title that I can't remember. Um, But yeah, so I worked with a local pediatric palliative care team, and we worked on taking clinical practice guidelines. So those are, if you're not familiar with clinical practice guidelines, they basically a bunch of experts in the field come together and say what the best practices are. And so practice guidelines are always getting refined and renewed and reviewed. But specifically, I looked at domain 6, which is the cultural aspects of care. And because the population that I was going to be working with is a pediatric palliative care team, I just took kind of 6.33 out of their thing that specifically talked about pediatrics, and uh, how you create culturally relevant care. And so my project is I created a training program around that clinical
And
practice.
you pick this program yourself, or does someone like give it to you?
You pick your own project, and then you have to find a site, which one of my classmates actually had built a relationship with this team. And so she decided to go in a different direction with her project. And so I was able to work with them. So it's kind of a convoluted project, and things evolve as you're in your program. Because again, before I had started, and some of it's based on your area of interest and also your site, what their area of interest. So when I met with this team, um, it had been brought up while I was there that some of their patients were feeling like um, they weren't being treated the same because of their race. And so that got a conversation. And I was telling them like, oh, my research interest and what I had, originally been looking to do was creating this toolkit for providers and stuff. And so I went back and did another couple literature searches, which are time consuming, but you want to see what's the available information out there so you can make best practices. Found this clinical practice guideline. And so that's kind of the highest evidence because um, that means that experts in that field have come together, have reviewed the available literature, and said these are our recommendations based on that. And so, but just like places have a diversity statement, right, or have some high level thing, clinical practice guideline high up here, right, and then you have your actual clinic or hospital. How do you get that from this high? This is what you should do, or this is your diversity statement, right? And how do you actually get it into practice? That's what my project was.
So what's the plan for the celebration after you graduate?
Oh no, yeah,
No party plan yet? No,
oh my
like
goodness.
there has to be something.
Yeah, I don't know. I
Yeah,
think
you
my
need,
family's working on
yeah,
that.
yeah, you need to get AJ on that.
Yeah, I think he's working on that. Yeah, it's definitely, 3 years, full time, um, is a lot, especially, post-pandemic. I started school in 2021, and so looking back, I'm like, "Was I nuts? Am I certified fully insane?" Because I had a newborn. Well, I guess at that time, Lola was probably about 18 months. Or yeah, about 18 months, I think. And, was working full time, commuting from Tacoma to Seattle, and then I was like, "Let's get a doctorate degree."
Yeah,
It's
you're like me,
crazy.
like I'm doing stuff 28 hours a day. Oh, here's another project.
Yeah, yeah. I know, it's a problem. I'm trying to work out. So, one of my goals is to live a softer life after I finish school and just,
We both know that's
take
not
the
gonna
time.
happen. You're gonna do something. You're gonna do. You're gonna next thing you're gonna like do some kind of AI website that do something right.
Well, I'm hoping to get back into, Zeta stuff and some of the nursing organizations and be more active in that. And it's going to be, first 2 years of a new job is
Oh
going to
yeah.
be a lot of a
Yeah.
learning curve, especially moving from, being a registered nurse to a provider. Is
So
a
here's
jump.
another like maybe potentially a personal deep question, right? Do you think you do all this stuff, you're goal driven and trying to do everything because you want to make sure when your dad looks down at you that he's proud of you?
No, that's a big part of it.
Yeah.
Yeah, absolutely. I have a lot of people that are looking down on me.
Mm.
My sister, she passed away 2008 from brain cancer. Um, and my son, so, and my cousin, and a lot of people have passed, are the with the ancestors now, and I want to make them proud for sure. But even before that, even when I was a kid, I just always
I miss, yeah, it says some people have it and some people don't, I think.
when and raising Lola especially, and she's curious, and she's
Is Lola, is that her actual name or is a nickname?
no, that's her name.
Name of Lola,
Yeah,
okay.
Trey is a
So,
nickname.
so like Lolo Jones.
Lola, Lola. She's named after my husband's grandma,
Okay.
who was Lola, and then my sister Grace. So
Okay.
she's Lola Grace.
Okay.
And then Trey is a nickname because he's the third. He's Ronald Wayne Murphy the third.
Okay. And you did a book called Lean Fit Curvy Chic Workbook.
Oh yeah, I did, for a few years because I guess I can't sit still. I don't know. I was doing like style
You
consult.
know you
I
can't
know I
sit still.
can't. I'm always in action. I don't know. I
Does that drive AJ crazy? Is he ever like,
it does.
Rosa, please sit down for 1 hour?
Yeah, but he's always running, but it's always in a different direction.
Okay.
So he's always busy too.
Yeah.
So um I don't think it drives him quite as crazy. I don't know, you could ask him. But yeah, so I was doing like style consulting and things before the pandemic and had created some different like workbooks and stuff. And so also again after Trey passed, had a lot of free time, so I published the workbook and the actual book.
So do you consider yourself a nurse, a student, a creative, a mother, a daughter, a wife, entrepreneur, or all the above, or some things I've missed?
I mean, I am all of the above, but I just think I'm Rosa and I have lots of interests. Um, I, I yeah, if you ask me who I am, like a nurse, like, I'm a healthcare provider, healer, nurse. Like a nurse is my job, but it is part of what I do and who I am. But I think I'm Rosa, and I just, at the core of me, I like learning and I like challenges and achieving things. And so, yeah, I think it's hard to put a label because I've done lots of things, but I just, I don't know. It's hard to
Is
put
there
a
a
label.
role that gives you like the most joy, most happiness?
I love being a mom.
Okay. Such a mom answer.
It is. I mean, I like a lot of, I like learning and stuff like that, but it, you know, be, and I was a bonus mom for a long time, and I helped raise my sisters and stuff like that. So I've always kind of been in the mothering role, and I'm the oldest, and so I've always been nurturing and helping other
Yeah.
people.
So I'll probably get blasted in this next question, right?
Oh,
But like, you talk about the curvy chick workbook, right? And this is to me for females and males, right?
mm,
I think there's a difference between like being big bone, thick, curvy, and being obese and overweight, right?
mm.
I think there's a lot of people who you're overweight, but they're not like how do like but they don't see themselves as that, right? Like how do we like have them like better term fix their health, eat better, like
So, so I think a lot we have to think about too is, um, we have our societal standards of
and
what
this
we
I know understand it's genetics and stuff, and
there's lots of things and there's lots of nuances to thing. And so like right now you see that there's a lot of weight loss medications that are out and there's a big controversy on who should get it. Should people just
what's the
get it
one
for
that's
weight loss?
big right now? That would
Ozempic
yeah,
and
that one.
Monjaro and
Yeah,
stuff.
yeah.
Um, so and even and before that, with weight loss surgery, some people are like, oh, that's a cop out. That's so easy. But
Mm.
surgery is major, right?
I
Like
don't care how minor the surgery is, it's a surgery.
it is. And there's risks to that,
Yeah.
right? Infection risk, slow healing, all this kind of stuff. And
'Cause, like,
so,
didn't, like, Kanye West's mom die
yeah.
from getting some kind of, like, plastic surgery or
Yep.
something,
Yep. She did. Yeah, it's always a risk. I mean, when you're I mean, for a lot of major surgery, you're getting completely, put under anesthesia.
Hopefully anyway, right?
You and hopefully you're waking back up, and so it's a risk. And
Yeah.
even minor procedures, we were talking about like the safety checklist because sometimes surgical materials get left in wherever they did
Oh,
surgery
I
or
cannot
whatever.
imagine.
It's crazy, but when you think about people that are, especially like people in the hospital aren't getting the sleep that they need, and they're getting pushed to do more and have more productivity and stuff like that. Um, with health, you can't just look at somebody and say you're healthy or not
Yeah.
healthy, right?
'Cause I'm sure there's a lot of, like, skinny people are unhealthy as, you'll get at, right?
There
Like,
are.
you might be 5'5", 140, but you have no muscle at all, like,
Yep.
you're sickly,
Yep.
and somebody might be, like, 5'10", 320, like NFL players, right?
Yep.
Basketball
Yep.
players, they're
Sumo.
sumo, yeah, sumo wrestler, that's a good
Yeah.
example, yeah.
Yeah. So, yeah, so there's so many components to health, and it's not just how you look. It's not how much body fat you have. Some of the, and some of the people too, there can be a lot of underlying health issues, both medical and mental health wise on why they have a bigger body habitus, as we say. Um, you know, and sometimes when people get to a certain weight or kind of medical condition, their metabolism is not the same as
Yeah.
somebody who works out. And so even though they're eating just a very little, their body is packing on
Yeah.
weight. And so I think that these medications are a wonderful tool. They're not the only thing. Um, and weight is a very complex topic. We like to say, work out more, eat less, and you're going to be good. But we know a lot of people that eat good,
Yeah.
they work out, and they weight doesn't budge. And sometimes that's because they have some underlying health conditions. Sometimes they have um, some mental stuff going on, right? And some people gain weight because they've been through trauma. Some people that's like a kind of body, we there's there's a lot of women that have been, unfortunately, that's a trigger warning, but like sexually assaulted, sexually abused, and they pack on weight. And this is just like one example. I'm not saying this is everybody. Um, as a body defense, they don't even like realize it, but you know, that's like their body protection. Nobody's gonna look at me if I'm, heavier or whatever. And so there's this whole mental component that we don't really talk about. And again, when you look at somebody, you can't tell what their blood work, what their
Yeah.
blood chemistry, because I know a lot of people that are heavier than what they should be based on the BMI or other measures. And I know for a fact that they work out, they eat pretty good. Some of them eat better than me, right? And somehow their body won't let go of weight. And so we have to dig deeper and back to kind of that functional medicine thing, like looking, was there like a trauma that when they started, when do they start gaining weight? Do they have some kind of, especially like a women's health, do they have like PCOS or some kind of other endocrine, uh, you know, hormonal type thing that's even though they're working out and they're doing all the stuff that they're not losing weight. And so I don't like when people are armchair you know, uh, positions or because it's really easy to talk about everybody
Yeah.
else, right?
Yeah.
And uh, the a lot of people that are, heavier, they have been shamed by their providers. They come in for one thing and then their provider's like, you need to lose weight, you need to lose weight. And then they're like, I'm not going to that.
Yeah.
And so now they're not getting the health care that they need. And and maybe everything else looked normal, like their labs were normal. The only thing that's wonky is their weight, but their blood pressure is good, their vital signs are good. And they came in because
It's a
their
total
need
package, right?
right, yeah. And so again, looking at holistic health, which is what I'm about, and looking at the whole person, is it because, they gained a bunch of weight during the pandemic? Is it because they're really depressed and they're not working out and they used to work out? We need to kind of unpack some of those things. And then also, if we do want people to be within what we society or the health industry says is a target weight, um, then are we giving them the tools, So is that a weight loss drug for somebody? Is that a workout program for somebody else? Is that a weight loss surgery? And like these are all like tools, but usually it has to be more than just that thing, right? Because just like there's people that have had very invasive surgical procedures to lose weight, and some of them gain weight back, right? That they're not really supposed to, but somehow they have. I had a coworker who I didn't know she had like um surgical weight loss and the kind where they kinda make your stomach small or whatever, and, she said, "Yeah, I had lost a bunch of weight, but I've gained back X amount of pounds." This was years and years ago. And I go, "Oh, okay." And I was like, "Well, I thought you couldn't, gain back weight." She goes, "Well, Rosa, the pouch only holds however many, I can't remember, milliliters of food or whatever." She goes, "But that can be ice cream or that" you know what I mean? Like, it could be something
Oh, wow.
unhealthy,
I never
right? And
thought
I
about it
said,
like that.
"Yeah, and so if you don't get through that mental health or I don't I yeah, if it was, like, depression on why they gained weight or, some kind of trauma or something like that, if we haven't worked through that and they recognize, because a lot of people don't recognize that they're, had this trauma, like, they know that that trauma happened, but how it affects all avenues in their life, right? They might just be like, "Well, I have PTSD because I was SA'd," or whatever, when, they don't realize, "Oh, man, that's also when I started gaining weight. Oh, that's when, I just let my health go because I was really depressed that somebody, did that to me." And so we need to look at all the things, and, we still have such a stigma on mental health, and it's so hard to get access, even if you have, insurance and you have benefits and you know the importance of it. It is challenging because there's not enough mental health providers, and we as a society have not given enough precedent to say, oh yeah, you should take the day off of work so you can go see
Yeah.
your,
And
because who's going to go to their counselor and be like crying and releasing and then go right into work, right?
no.
That's not a good.
And plus, society, I think back in medieval days, like, lack of a better term, the plumper a female was, the more attractive she was,
Mhm.
because if she's kind of bigger, that means she can either cook or she has a lot of money, right?
Right, right, because most people were starving and
Yeah.
they were very skinny, and so, yeah, so, throughout history, we've seen different body styles, especially more so in women, right? And this, again, is patriarchal, where women's value, is seen by how attractive they are or what they can, bring to the table physically or whatever, in terms of being a mother and having children and passing on genes and that kinda stuff, because we don't see it as much as, so in some ways, uh male body shapes has kind of changed. Like, in the 70s, it was more like thin, kind of athletic, and now we're, the more desirable is like really muscular and cut up abs and
Well, I
that
think
kind
it's
of
kind
stuff.
of like ironic, kind of hypocritical. Like the females have all this. You're supposed to look a certain way,
Mhm.
but then you're a male. It's like something like dad bods in, right?
Right.
Like what? The dad bod? Like what the fuck is
And is
this?
that healthy too? Because
There's
it's
no way.
right.
There's
Because
no way.
most of it that means that you just kind of let yourself go,
Yeah.
right? Or maybe I guess if we want to put a positive spin, maybe you're spending so much time being a dad that you don't have time to go to
Yeah.
the gym. But
Maybe so. We'll go with that.
yeah, we'll
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 go
leave
with
it on a
that.
positive.
So is this another book you wrote? From Trial to Triumph, Woman Beating the Odds.
So I wrote a chapter in that. That's not,
Okay.
yeah,
That's what it is, a
yeah,
chapter
yeah,
book. Okay.
yeah. It was
And
a book
how did,
collaboration.
like, did someone reach out to you for this, or?
Yeah, one of our sorors, Sora Simmons, had reached out, and I was like, oh, this sounds like a cool project. So there's multiple different authors that kind of, it's all women who kind of, wrote a chapter about some impactful
And
type.
did you pick what you wanted to write
Mhm.
about? Okay, so she, like, just said write a chapter and you had the free reign to write about
Yep.
anything you wanted to?
Yep, yep. So I shared about, our journey with Trey and, we had to go through revisions and edits and that kind of stuff. So it's kinda interesting to be in a bigger,
And so you're like a published author now?
I am a couple times over.
Nice,
Yeah, yeah,
nice.
yeah. So that was the first time I've been in a collaboration like that.
Okay, nice. And that's an Amazon book, or they,
That
like,
that one's self-published, so it's available on my website.
okay, okay. And then what is melanatedhealthsecrets.com?
Yeah, so that's a blog that I started a
Are you still doing it?
I am, yeah, I just did a bunch of, fibroid, blog posts on there. I'm hoping to be, more active, but I really, wrote it to target, melanated women like myself, because when you look at statistics, unfortunately, a lot of us, have poor health outcomes in everything. If you look at maternal health outcomes, if you look at surgical outcomes, if you look at customer service kinda experience, um, we're at the bottom, unfortunately.
Let me ask you this. So, like, obviously there's like discrepancy between, like, white people, non-white people, Hispanics, immigrants, whatever. But are those same numbers the same if you compare it to, like, economic well-off people and economically disadvantaged people?
Unfortunately, yeah, especially when you look at Black women's health outcomes, even controlling for socioeconomic factors, so even the wealthy, Black women are having poor health outcomes. I
Okay.
always think about, um, Serena Williams, the famous,
Yeah.
tennis star. Uh, she had blood clots after I think her first child she had a
I think
history of
I
blood
remember
clots,
hearing that
yeah,
story.
and she was like, "This is a rich, rich woman married to a rich,
Well
rich."
known
Yeah.
and well-known
And
husband.
yeah, and very rich.
Rich, rich
Like
as
he's like
rich AF.
yeah, like billionaire, I think, or something close to that, right? So they're in a private, like great hospital and all this kind of stuff. And the fact that she had to advocate for herself and say, "Hey, I need a CT scan. I think I'm throwing clots." And like I'm somebody who's had blood clots. I had to be on blood thinners the entire pregnancy for Trey and for Lola. And then, like, because I had to have a C-section, I had to stop blood thinners for a period of time, which put you at an additional risk. And just giving birth and surgery put you at an increased risk for blood clots. So, so anyway, she had to advocate and tell them like, this, I think I'm having blood clots, I'm having these symptoms. And this is somebody who's already had blood clots and she's in a population that's at a high risk. Um, and she got pushback, right? So I'm like, if this rich woman who's world famous can't even get standard of care and is identifying a problem, like what I always say, like what hope do us mere mortals have, right?
Yeah.
And I even me being a nurse, I've had to advocate for myself very strongly for friends and family for certain stuff that it just seems like it's glossed over or whatever. And um, there's a lot of unfortunate stereotypes that uh, are in our culture and have permeated to healthcare about you know um, Black women being stronger or not needing pain medication and this and that and the other thing. That is really unfortunate. So, but I'm like, if this rich person in a like they don't deliver, those kind of rich people, they're not delivering at St. Joe's, they're not going to UW, they're like at a private wing in like a private hospital, right, with security and all that stuff. If she can't get the standard of care for somebody who's saying, I think I threw a clot, who's had a clot before, so very and somebody who's a elite athlete, very aware of their body, right? Um, what hope do we have if we're not, empowered and we're not educated on the things we need to advocate for? So yeah, even when you control for socioeconomic status, Black women still have the worst outcomes, especially in maternal health. I mean, it's abysmal. It's really bad.
So can you talk about your dedication to holistic health and serving underserved communities?
So, um, yeah, so I volunteer a bit. In my program, I've done a couple rural health rotations, both to Eastern Washington, Southeast Washington. Working with veterans, even in this area, is still underserved populations. Um, and then I do a fair amount of community service with, like I said, volunteering at the hospital, um, and other opportunities that I've done, like some PAP clinics and things like that. And like I said, just, within my friends and family group, just trying to help be that translator, I guess, for lack of a better word, when, people are getting health information. And I don't know everything. So I'll tell them too, like, well, let me look that up. Because, in healthcare, things are always changing. Um, and things are, standards are changing, things like that. So it's hard to speak like, oh, unless that's like your area of expertise. A lot of stuff, you got to go and look up, but at least I can help them with like the tools and the language. And so that's what I've been trying to do too on my blog is, um, you know, help people to speak the language of, healthcare and be able to understand it so that you can advocate for yourself because you are the best advocator. Like, your body, and the best relationship with a provider is going to be one where you're both valued and listened to. And so, if you come in and you start yelling at your provider because, the 10 providers before didn't diagnose you with something, that's not going to open up a good relationship either. And yeah, you can be frustrated and stuff, but like when you take that out on your provider, they're going to be like, oh, geez, like I don't want to see that person. Right. Because they're also a person too, and they're dealing with all the stuff that they're dealing with, and I think when we put people in pedestals, we forget that they're not a god. They are a person. Like they have childcare issues. They get sick. They have, family members they're probably caring for. Um, they got bills to pay and all that kind of stuff. And so, if you're able to both, work collaboratively and in a holistic manner, because like I said, health is not just, oh, you weigh perfect amount, your blood pressure is good, and, you're taking your medications when you're supposed to, right? Like health is a spectrum, right? And it's your mental health, it's your physical health. It's you being able to age gracefully and live in your house for as long as you want. It's you being able to be there for milestones for your kids or nieces and nephews, your grandkids, whatever. It's you being able to wipe yourself, right? Because we see a lot of times people have had a stroke or some other incident like that. Um, Sometimes they can't do that, and it's very humbling to have somebody else do that for you. And most people don't don't want somebody else to do that for them, right? We want to be able to tie our own shoes. We want our independence, and so also finding out what's really important to your patient. So, like, you know, I see a lot of patients that are smokers, right? And a lot of them have been smoking for majority of their life, right? And, we're always asking them, like, "Do you wanna quit smoking?" And a lot of times they're like, "Rah, rah, rah, rah." But, sometimes find out like what their motivation is, like what's important to them. And maybe they're like, well, I want to be able to be here for my grandkids or whatever. And so then you're like, okay, well, with you having this 50-year pack history of smoking, that's
That's
decreasing your
that's a
odds.
lot of smoking.
Well, yeah, yeah. And I see that a lot I mean, because it's you multiply the packs that they do per day times how many years they smoked. And a lot of people started smoking when they were like 10, 11,
Yeah.
12, before the
What the
legal age.
brand is. Some brands are worse than others, I'm guessing.
I think they're all pretty bad. So, and if maybe we can have a conversation and you can start cutting back, because that every little bit helps. And I think that's too, we always want to jump from like from this to this, right? Like, no, no smoking and for some people, maybe that's what they need to do, but maybe they need a process to get there, and with like health goals, we say we want to lose 30 pounds in 20 days. That's what we said earlier, or 2 months. And that's not really realistic, not in a healthy
Unless
way.
you want to start smoking crack and fentanyl, something like
Right,
that.
right. You could probably do it then, but I don't think you're gonna make it to your reunion or
No,
whatever.
not
Uh,
recommended at
right,
all.
not recommended. And even if you were able to lose that, you're probably miserable,
Yeah.
and then you're gonna gain it right back, right? And so if we want to do sustainable things, and that's something I try to share, especially um, in my blog and with the women that I work with that making small sustainable changes. Like I can help, like, let's look at your schedule. Let's see, I saw a patient a few weeks back whose husband was deployed, she's a veteran, and two kids under no, three kids under three. So I think they had a set of twins and then a younger one. Yeah. So I was like, oh, you got a handful. And she wanted to start losing weight and stuff. And I told her, and shared to her from like, I'm a mom too, I'm a student, this and that, just making small changes. Sometimes, as like, especially for you have been active duty, you might not, you want to get back to the gym or you want to get, but like, let's start where you're at now. Your husband's deployed, you got these kids. When the weather's nice, throw them kids in the stroller and walk 15 minutes one way, walk 15 minutes back. And I told her like that's what I had to do when I started like realizing I had gained so much weight in 2020. Um, I would get home, I would just throw my stuff inside, I'd throw Lola in the stroller and we'd walk for 30 minutes before I even got in the house. Cause once I get in the house, then I start seeing all the things I need to do, you know. And so just making those little small changes and things like, parking further away and adding steps. Like
Yeah,
I have
they're taking the stairs to the elevator.
Yep. Yep. And so those little things do add up, especially when you're consistent about it. So like I was like, I got this Fitbit for Christmas last year or 2 years ago or whatever. And it's like a little competition. I try to get to my goal of 10,000 every day. I don't always make it. I don't like beat myself up about it, but I'm like, I'm gonna do it tomorrow. And it's okay to reset even when you make a mistake. You ate that unhealthy meal, right? Don't just like throw it all
Yeah.
out, right? Just say, you know what? Okay, that was my cheat meal. That was my cheat day. But you know what? I'm gonna meal prep tonight and I'm gonna get stuff ready. And so I think we don't think of that way. We don't split up our goals into like mini goals and we don't we have this all or nothing approach and it's not sustainable, it's not healthy, and it makes us, feel really bad about ourselves when we don't meet these like arbitrary line in the sand type of goals. And so I think having grace with ourselves, especially as we're trying to get healthy and just realize everything that we do, just try to do a little bit better tomorrow.
So back in the day, there used to be a thing called a family doctor,
Mhm.
especially like small country towns. You had a family doctor. Like the doctor probably saw your grandparents, your parents, you. I feel like that's pretty much gone away, right?
Yeah.
Is there a way to? I mean, I think that's a good thing right now. Like I know when I go to Madigan, I might see Doctor So and So, another doctor, right? There's like no like what's the word looking for? Like no
Consistency.
consistency, right? Is there a way to bring it back, or is this like a bygone era that will never come back?
Yeah, so that, we've seen healthcare change a lot in like a generation because just a generation ago that was the norm. We've seen the birth of a lot of specialties. There's like very specific providers for different things, for your heart, cardiologist, for your brain, neurologist, mental health providers, this and that kind of divided up the body because, healthcare, our bodies haven't necessarily changed. But healthcare has, right? And the different technologies and abilities, and that's changing so rapidly that it's hard to know the whole body head to toe. And so, yeah, the family kind of physician or provider has kind of morphed into a primary care provider. That's supposed to be kind of your hub, and this will be my PSA. everybody needs a primary care provider, and find one you like that you want to go to, because they are the hub for all this other things. And even if your insurance allows you to go to a specialty provider without an authorization or referral, there's nobody to coordinate that. So if you go and you see a neurologist, they're planning on sending that information back to your primary care, because they're not necessarily going to do follow up with you. Maybe they'll do some like medication management or something like that. But their role is not the primary care provider to take care of you head to toe. So your primary care provider is kind of like your hub, and they take care of you from head to toe. But they send you out to a lot of specialty care of things that are maybe outside of their scope of expertise. I'll say not practice, but scope of expertise. But they get that information back from those specialists and have to kind of make whatever changes and manage some of those different components. And so, a lot of this has been insurance driven as well. Um, and I think we're on an unsustainable path where there's not a lot of providers going into primary care because of the long hours. It never ends. And low reimbursement, which means low wages for providers in those specialties. Um, and so a lot of people everybody's going into specialties because you can make a lot more money, right? And have less stress and only deal with like one specialized body part, because it's a lot to know everything about the whole body, right?
And the risk you get something wrong.
Yeah, there is a risk of that. And especially when you're trying to manage, everything. Because there's a lot of like diseases and conditions that have similar symptoms or have very like vague symptoms. It's like, oh, I've been coughing. Well, is it COVID or is it lung cancer, right? Like, or something in between. Um, and so, yeah, those providers are very stressed out. The older ones are, retiring, and newer ones aren't really coming into that specialty. But there has been kind of movement where people are doing like concierge healthcare, where providers are like, I want more control. A lot of these are like only taking cash. And so they are kind of like the family doctor. Someone will come to your home, do your lab work, do whatever. They have a small panel that they get to choose, right? Because if you're an a-hole, it don't matter how much money, I don't have to take it, right? And so there's a movement of that. So I know quite a few people that, either are providers or are patients of providers that they can call, I'm feeling sick. Can you come over?
Yeah.
Or, I think I have this again. And actually a lot of healthcare providers that I've been meeting, their providers are concierge, and so they feel like it is a more personalized approach, but also like they kind of value, oh yeah, you're a nurse practitioner, or you're a provider yourself. And so if I'm calling you and saying, hey, I'm pretty sure I got an earache, can you just ear infection, sorry, can you write a script for it? They're like, oh yeah, we know you are this, blah, 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 and
Yeah.
we're gonna call it in or whatever. And so you don't have to wait, 3 weeks to get in for an acute type of symptom. By that time, it's already gone. So there is a movement towards that, but that is only available for people that are able to afford it.
So what kind of entrepreneurial stuff are you doing right now?
So I have been working on my blog, and also I have been working on some like online programs around hormonal health for women. And right now I'm working on some programs and courses for women with fibroids, because that's very near and dear to my heart, and disproportionately affects Black and Brown women. Um, and yeah, that's what I've been doing in my spare time.
And who are your mentors right now? Who's mentoring you?
I have a nurse coach that helps me with a nurse business coach. I have I mean, I have mentors in my faculty, working like for school and projects and stuff like that. And my current boss is a great mentor for like the management role.
And follow-up question, I mean the more important follow-up question, who are you mentoring right now?
Formally, I'm not mentoring per se anyone, but I like not like an ongoing thing. But um, with my cohort of classmates, we all have our areas of expertise, and we all have had different um, years of experience in nursing. And so I'm one of the most senior classmates, both in terms of age and in nursing experience. And so there's different things that I help my classmates with. And it's funny because a lot of them are younger than me, And like, yeah, still a lot of the tech stuff, it seems like, I guess, because I'm just so interested in it, then I'm like, how do you guys not know how to do this? But and I even say that with my, the 17 and 20-year-old kid where I'm like, you guys know how to make TikTok videos, but you don't know how to do PowerPoint? What? And like to me, that's like a basic life skill. Like you got to get that Word or sorry, off Microsoft Office suite
Yeah.
down, for any kind of job. And so, yeah, I think I have a lot of informal mentoring. I just had kind of met with kind of informally with an old coworker who's also in a nurse practitioner program, and was giving her some advice and telling her like scholarships to apply for and stuff like that, and things to be aware of as she's, you know, moving into the clinicals and stuff like that. And just giving her some encouragement and, because she's like, everybody says you have to like, you can't work this many hours and da da da. I said, yeah, I said they said that at my school too, like constantly. I said, but I have bills to pay. And that's one of the things too. I think, like I said, I know that I have a privilege that I'm able to be in this program because it is hard. And some of my classmates have been able to not work because they have family or spouse or whatever. I'm not in that position. But I told her, you've done hard things. You're raising 3 kids. You know what I mean? I was like, you can do it. I'm not saying it's easy. And I said, now is the time to start tapping into your network and saying, hey, I'm going to be starting clinicals. Like, maybe there's even another classmate and you guys can split a babysitter or whatever. You got to be creative about it. But I was like, you can do it. You can do it. And I was like, me and one other classmate, we've had to work basically full time while we're in this program, which they don't recommend. And here we are about to graduate in like 6 weeks.
Do you ever see yourself retiring, or you think you can be working and doing stuff up to the
I want to
day?
retire as soon as I can. So I'm almost I'm like at 13 and a half years federal service. I see myself in the federal system until I get my 20. Then I like to work for myself. So that's one of my goals is kind of, you know, maybe build up a telehealth functional medicine practice on the side and then retire into that. And hopefully make some smart investments with like my retirement accounts and other accounts. I don't want to work till I want to be busy and active because
Okay.
I do know that when you see people, especially when men retire, a lot of times they're like that's a lot of their identity and
Yeah, it's
their
like,
drive,
yeah,
and they can really
they go
their
fast.
health can go, yeah. And someone will go back to work,
Mhm.
and maybe it's not the same job, but like maybe it'll be a Walmart greeter, so they're out or um, and so I know that I'm somebody who likes to give and likes to do things that I love. Whether I win the lottery that I don't ever play, or get
Now
my
you're now
retirement.
you're you're very lucky to win the lottery without playing.
I know, I know. That's how some of us kind of have this magical thinking. But when I retire, I would love to be able to volunteer and mentor, and I know that I'll keep myself busy and travel and do different things. Um, I don't think I'll ever stop learning, but working for somebody else, God, I hope so. And before 67, I'm like, oh no. And I
Yeah.
see people that are much older than me still working, and I'm like,
Yeah, it's like you gotta think of something. Is it because they made bad economic decisions, or just a bad thing in life, or it's like did they
that's
burn
all there is.
bridges, or
Sometimes that's all that's like
or because they do it
that's
because
what
they
they
want to get out there?
right. Yeah, that their work has been their identity for so long, they don't know anything else to do.
Yeah. Um, is there anything else to ask you that I didn't, or anything else you want to talk about?
Think so. I think we
Okay.
talked about a lot of stuff.
Yeah. Um, can you say your social media in case anyone wants to reach out to you?
Yeah, I'm on most social media. IG is probably where I'm most active. I'm on TikTok, Facebook, but at Rosa Crumpton, RosaCrumpton. And my blog is melanatedhealthsecrets.com.
All right. And before we go, we talk about a lot of stuff. Can you give us any last minute advice on wisdom or anything you want to talk about?
Yeah, I would say my my soapbox topics. Number one, if you don't have a primary care provider, please find one today. I know it's a struggle. It can take, a couple interviews to try to find the right provider. If you don't have a good relationship with your provider, shop around. We are fortunate to be in that kind of time that we're able to do that. But it's really important for you to have somebody that knows your health when you are somewhat healthy, because if you do have something happen, the emergency room or the urgent care, they don't have your whole record. They don't know all the stuff that's going on with you. And that's not where you get treated, especially for chronic health issues. And then my second thing is if you are a veteran and you have not signed up for your veterans benefits, please do that. You can file online. You can call the number. Just Google like VA benefits or whatever, and it's a fairly straightforward process. But it does take time, so go ahead and get that started today.
Rosa, thank you for being here today. I really appreciate you.
Thank you so much.
And to our listeners, thank you for your time as well. Remember to be great every day.